Thanks, David. Welcome to this virtual hearing of the Public Accountability Committee as part of its inquiry into the New South Wales Government's management of the COVID-19 pandemic. Before I commence, I'd like to acknowledge the Gadigal people, who are the traditional owners of the land upon which the Parliament sits. Pay my respects to those First Nations peoples from across the state, and especially those witnesses and elders who have taken the time out to come and share with us their knowledge and experience from the ground today. And we acknowledge that this land is Aboriginal land. Today's hearing is being conducted as a fully virtual hearing, which enables the work of the committee to continue during the COVID-19 pandemic without compromising the health and safety of members, witnesses and staff. As we break new ground with the technology, I'd ask everybody to be patient, especially as we have a series of witnesses from northwest and western New South Wales and the notorious difficulties we all have with ensuring that we keep connectivity on a day like this. If participants do lose their internet connection and are disconnected from the virtual hearing, please rejoin the hearing from the link that you have been sent by the Secretariat. Today, we'll be hearing from community health organisations, from local councils and from community members who are tackling the COVID-19 situation in rural and remote Aboriginal communities. We'll also hear from representatives from the Aboriginal Health and Medical Research Council and individual Aboriginal medical services. Later this afternoon, we'll hear evidence from the key New South Wales Government agencies who are responsible for the COVID response, including the Ministry of Health, the New South Wales Police and Aboriginal Affairs. Before we commence, I'd like to say a few brief things about the procedures for today's hearing. While parliamentary privilege applies to everything that's said in the course of these hearings, it does not apply to what is said outside, and I'd urge people to exercise caution with comments they make after the hearing. Committee hearings are not intended to be a forum for adverse reflection on individuals, and so far as possible, please stick to the issues rather than making adverse reflections on individuals. All witnesses have a right to procedural fairness in accordance with the resolution of the House, and that right will be respected in this committee hearing. There may be some questions that a witness can only take on notice. You may not have the answer to hand. That is okay, in which case, please let us know, and you can provide the answer within 21 days, and the Secretariat will help you with that. Today's proceedings are being broadcast live from the Parliament's website and on the Parliament's YouTube. And a recording of the hearing will be uploaded to the Parliament's YouTube channel at the conclusion. As always, a written transcript will also be provided as soon as available from Hansard. Finally, a few notes on virtual hearing etiquette to minimise disruptions and assist our Hansard reporters. Can I ask committee members to clearly identify who questions are directed to? Members should also utilise the raise your hand if you want to take a point of order. Could everyone please mute their microphones when they're not directly speaking? And please remember to turn your microphones back on when you're getting ready to contribute. Members and witnesses should avoid, wherever possible, speaking over each other. And also to assist Hansard, may I remind members and witnesses to speak directly into the microphone and avoid making comments when your head is turned away. I'd now like to welcome our first panel of witnesses. First, starting with Auntie Monica, could you please state your full name, your position title, and then take either an oath or an affirmation, a copy of which should have been provided to you.
Hi, Monica Curl. Kenya resident, born and raised in speaking community. And haven't got both. Repeat it after you.
Monica, we're having some connection difficulties with you. You're coming in and going out. Did you want to try again? If you've hit a sweet patch on reception, start again, please, Monica.
Sorry, we have bad internet service out this way.
Well, don't move. Wherever you are now is working. And again, I'd invite you to your name, your title, and take either an oath or an affirmation, Monica.
I'll take the oath, but I'm Monica Kerwin, born and raised in Kenya. I speak a lot on issues. Just a resident of
Thanks, Monica. And an oath?
Yep,
Do you swear the evidence you give will be the truth, the whole truth, and nothing but the truth? So help you God. If so, please say I do.
I do.
Thanks, Monica. Then, Mrs. Ronayne, could you please state your full name and position title and take either an oath or an affirmation, a copy of which should have been provided to you? You're on mute, sorry, Mrs. Ronayne.
I'll do that often. I'm very sorry.
That's okay, we all do it.
My name is Mary Renane.
Thanks,
Mary
Mary.
Renane, Community Culture Manager of the Wilcannia Safe House. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth. So help me God.
Thanks, Mrs. Ronayne. And now, if we could hear from the Mayor of Broken Hill, Councillor Turley.
Good morning, everyone. I solemnly and sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth. Thank you.
Thanks, Madam Mayor. Charles.
Yeah, Charles Lynch. I solemnly and sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth,
Thanks very much to all of you, and thanks again for the time. I know how much your communities need you right now, and we really do appreciate the time you've taken away. Auntie Monica, perhaps starting with you, did you want to just give us a brief opening about what's happening on the ground and what you'd like us to hear?
Well, at the moment, can you hear me?
We can.
Well, at the moment, there's a lot of, I believe there's a lot of anger, confusion, a lot of misunderstanding of what's happening here, and more so around what's the next step to our community having cases. Yeah, so I don't know what else you want.
That's okay, Monica. And you're speaking to us from on the ground in Wilcannia, is that right?
I am, yes.
Yeah.
I live in community.
All right. Thanks, Monica. The committee will have some further questions directed to you. Mrs. Renee?
Yes.
If you'd like to give us a brief opening about what's happening on the ground from your perspective.
Yeah, so Monica spoke about the confusion. So everyone's worried about what's going to happen after the temporary accommodation is removed from the service. We've always had an overcrowding problem in Wilcannia, and everyone's worried about what's going to happen after they are removed, and continuous outbreaks of COVID because of our overcrowding problem.
Thanks, Mrs. Renane, and we'll probably come back and get some more detail again through questioning. Madam Mayor?
Thank you. So in Broken Hill, can I just firstly acknowledge that I am on the land of the Barkindji people, and I want to pay my respects to all elders and acknowledge the work that Mrs. Renee and Monica are doing in all the communities across the far west. You know, what we're seeing at the moment really could have been predicted or should have been predicted in terms of how this rapid spread is affecting our vulnerable communities. You know, people have spoken to me and believe, you know, public health experts in the past believe that the failure to act adequately in advance is tantamount to a genocide. We are very concerned about the modelling of what we will see in COVID positive cases in our Aboriginal community in Broken Hill. We've seen, you know, with much sadness how our community, although it's 200 kilometres away, Wilcannia is in the heart of Broken Hill. We love it to death. You know, we know it's looking after the river, and we, you know, are so concerned. But what we're seeing here now is the numbers in our communities are rising as well. There is preconditions that could have been determined, and all you have to look is the lack of investment in health in housing and employment in our communities, and you could see that it is the perfect combination for that perfect storm to erupt in these communities. You know, I'm just struggling to believe that over the years, as I watched all the fireworks in Sydney and all the investment in those capital cities, that for those communities in the far west, the First Nation people, all we've seen was drip feeding of funding and Band-Aid service. So at the moment on the ground, we're going to see our communities struggle over the next couple of months. And also, I just want to acknowledge the great work our health workers are doing, but there is going to be great impact on how we look after them and what the outcome is for them in the future. And also, nobody's talking about a recovery.
Thanks, Madam Mayor. Councillor Lynch.
Yes, good morning, everybody. Charles Lynch, I'm the Councillor for Northern Region, and I'm also the Deputy Chair of New South Wales Aboriginal Lands Council, and I'm the Co-Chair of CAPO, so the Coalition of Aboriginal Peaks in New South Wales. I thank you for your time and opportunity to speak today, and I also want to acknowledge country that we all gather on today and pay my respects to elders, both past and present, and I'd also like to acknowledge our future leaders. As already noted by some of our community members and other people online today, I also want to highlight and thank those frontline workers, our community workers, community members that are out there every day dealing with the issue at hand. From my perspective, you know, it's government's responsibility to keep all citizens safe. Government holds all the levers and they hold all the resources. And it's importantly that government works with Aboriginal communities in the best way to resolve the issues going forward. And whilst we're in a pandemic, and whether or not we could have had a crystal ball, I think right now is not the time to be pointing a finger, but it's importantly that we get the planning right going forward and ensuring that the effects of COVID, which are going to be around for a long time, are dealt with in our communities. The government is working collaboratively with our communities on the ground. That will need to come with capacity and resourcing into our Aboriginal medical services, our other community organisations, because they're the people that our people trust, and they're the people that get the services done and are carried out on the ground. There's many things that need to be highlighted. That is starting with the lack of information or coordinated information. I continually look at briefs that are coming out that are 12 pages long. Our people don't want to read 12 pages about the incidence of COVID. We need fact sheets that are specific to our people that they can understand and get straight to the point. And more importantly, at the moment, the anxiety and mental health that's being caused in our communities, and we have very remote communities that are affected. But I have two also remote communities that I'm sitting in Tam with, by the way. So I have a little place called Wahola or Karuna, and I've got another reserve sitting at Somervale in Walker. And the anxiety and mental health that's coming with our most vulnerable at the moment due to the lack of information, the unknown and the forward planning is horrific. So I think there's a lot of matters that I would like to raise. And obviously, at the end of the day, this is a health pandemic, and the Commonwealth and state government are responsible to ensure that not only our people, but that all people are safe and these matters are dealt with appropriately.
Thanks very much. Thanks very much to all of you. I'm now going to hand over to the opposition for the first round of questions. Ms. Sharp.
Thank you. Thank you very much, everyone, for coming today. I know that you're in the peak of the crisis as we speak, and we thought it was very important to hear from you. Auntie Monica, I wanted to ask you about, you previously raised with me the issues of accommodation and that kind of thing. I understand that there's now been motorhomes put into Wilcannia. Are you able to tell me how they're working and what you understand the time frame is for them to remain?
Been a lot of like with the slow response in getting those homes in here, has left a lot of the community very confused because you know, it took them a month really to get them in here, and the numbers have risen since then. So a lot of the community found that it was really no use to them because they've already affected the majority of their families. Overcrowding situation we have here. And, you know, I've been ringing around and asking communities staying in them, whether they're local, but they're not local that are actually staying in it. They're families that have travelled in sorry business because from the first outbreak and you know, that very sad funeral that happened when COVID broke out here, we've had a suicide in the community in the preparation of leading up to that funeral. So a lot of families travelled in. We weren't under lockdown, but they're the families that travelled in for that sorry business are the ones that have been shifted out of a hotel here now and put into those camper vans. And, you know, a lot of confusion with them is that they don't know their period of stay, know whether they leave there or what they, there's just a lot of confusion around all of the accommodation that's been allocated around. And even with the motorhomes coming a month later, tried to get family out, but we had to go through South Wales Health, which was a phone number we had to go to somebody around, which was a part of the LEC meeting. So just a lot of confusion there here on the ground. It's, you know, turned into frustration. They're just saying, well, we better all stay in here now, just be in lockdown together, still with the situation. So that's all I can sort of say on that matter.
No, thank you. That's very helpful. Mrs. Renane, in terms of coordination on the ground, what do you? There seems to. Can you just take us through how things are being coordinated that you see from where you are?
So we have a local emergency management committee that's been functional since before Health stepped in, and it was through the coordination. So they are the main coordinators of all the food distributors, and then worked with community and services to be able to source that immediate accommodation for anyone that needed to self-isolate at the start. And then we had the mobile units turn up, and so we have 30 mobile vans over at one of our caravan parks. I have not heard of a date of when they will leave, and that's what the community members that I've listened to and heard and spoken to, that's worried about what's going to happen, because it started because of overcrowding and it spread, as Monica quoted 12 months ago, that it would spread like wildfire if it ever reached Wilkenya. And it seems like once that temporary accommodation is removed, we'll go back to the same situation.
Thank you for that. That's very helpful. Councillor Turley, I was going to ask you about, I suppose, information sharing. There seems to be a lot of agencies now in the middle of both, Wilkenya but Broken Hill as well. And I'm just wanting to know where, with the local emergency committees, whether the planning for that was done beforehand, and importantly, I also would ask you about how the vaccination coordination is going.
Thank you for the question. So firstly, in terms of the local emergency management committee, on the ground in Broken Hill, I just want to say that the work they're doing is very good, but I don't think that overall the government had a plan of how to respond to such a pandemic. If I reflect over the years, sorry, I'm full of allergies today, and my apologies if I have to sip water. If I reflect over the years, we could see funding cuts to communities. When you see, and Wilcannia's not in my local government area, but Broken Hill is the same. If you look at the housing structure, poor housing for our Aboriginal community, the overcrowding, government has been missing in action when they've these high issues of importance. When you look at the social determinants for health, we already had a perfect storm happening where government were cutting funds to these rural, remote areas of the most vulnerable people, yet they're our First Nation people. So there was a perfect storm happening. The local emergency management committee are working well, but I don't know if there was a state plan of how to address those issues that are leaving our most vulnerable communities at risk. Maybe maybe you could answer that for me. But in terms of vaccination plans, I think I reached out to Councillor Lynch just before our lockdown on the Friday, saying, how do we actually increase, give me some ideas about how we could work together. And it was really an issue for me about the low vaccination rates, not only for Broken Hill, but across the whole far west. Broken Hill at the time was 50% first vaccination, 30 to 39% second vaccination, but I couldn't see a traditional public health program being rolled out targeting all at-risk people for vaccinations. We know that vaccination not only prevents you from getting sick, where you could still get COVID, but you've got 80% chance of not getting COVID. You could still get it, but you're not as sick, and also you're not going to pass it on. So we knew the science was there, but we couldn't see a good old-fashioned public health program on the ground, inter collaboration, working together to get our communities vaccinated. And it was a great concern to me that wasn't being done. I can reflect back in the 80s and 90s, if we look at HIV and AIDS, how those public health messaging worked on the ground, community collaboration, working with partners to get people vaccinated or to get people tested. I wasn't seeing that, and it was a great concern to me. And, we really need to double vax at the moment. We really need to get across the areas. Some places are doing it well, others, really struggling. And that's because we may have a problem about staffing at the moment and how our staff, our health workers are really overworked and what the impact will be for them. But we need good public health, old-fashioned public health messaging. We need on the ground, collaboration to get our community vaccinated. And we need to tell the community why it's important to be vaccinated. Thank you.
Thank you. I think that's my time. So I think for now, I'll come back. Thank you.
Oh, Penny, I think that was just the first 10 minutes of of opposition. If you wanted to ask some more questions, I think time's available for opposition.
My apologies. That means, sorry, I've misunderstood.
Yep.
So I wanted to, the thing that I'm particularly interested in, everyone speaks very highly of the local emergency management committees. And I'm really trying to understand what seems to be a disconnect from statewide planning. We've been in a pandemic for 18 months. We knew that Delta was going to arrive at some point, that it was different. We've been assured that there's been planning, but it's very clear from what's happening in places like Wilcannia, Brewarrina, Dubbo, that it doesn't look as though that local planning has been done. And are any of you able to have a view about sort of what, obviously you're quite involved with the local management committees, but yeah, so whoever wants to, I think, yes, I'll let David, you can choose who answers that, but I'm happy to hear from everyone on that.
Well, I think we'll start with Monica, and then we'll go to Mary, and then we'll go to Charles, and then we'll go to the Mayor. Monica?
Thank you. I was involved with the local emergency management 12 months ago, one of the things we sat on, basically spoke on in that management was in the likely event that COVID enters our community, that we need a foolproof plan put in place to protect our people. You know, sitting on there with other government agencies, and you know, I sat in there as a position, chair of the, I don't know if you're with it, but the Community Working Party, which is spokesperson for Aboriginal issues in our community. And one of the things we wanted, you know, foolproof was the overcrowding situation. We needed that plan to be foolproof, so that if the likely event, and this is 12 months ago, that COVID got into our community, that we, you know, find somewhere to put our people that are living in overcrowding situations. You know, and I felt at that time that nobody really listened. You know, nobody really cared what our opinion was. I felt personally that our opinion wasn't valued at that level. And we only ever wanted to be a part of a solution here, protect our community. So, you know, as grassroots and living and seeing a lot of the overcrowding in this community and issues that an outbreak would do to a lot of these families, you know, it was heartbreaking, you know, to know that. And then now that COVID is actually, you know, the response I feel was very slow indeed, that if we would have put a foolproof plan in 12 months ago, you know, we wouldn't have the eye numbers that we do have in our community right now. So, you know, I feel heartbroken, angry, just like the community, to a slow response in a plan. And, you know, we haven't, since COVID hit our community, have seen any sort of plan on the ground here at grassroots level as to what was actually put in place, from sitting around their tables, you know, having these hard conversations, to, you know, the next step now. So, you know, we feel that we've been let down, you know, to the point where, you know, trying to accommodate us now after the effect of it is useless, because, you know, should have been a foolproof plan put in place to begin with. Grassroots levels, people speaking at that table, because we live in community. We know the effect that it would have on our people if it did get in here. So I sat around those tables and spoke, you know, not only myself, but, you know, another young fella in a leadership position. We spent numerous hours sitting in phone call, you know, doing phone conferences. So, you know, to know that there was a plan, actual plan that would work for our people, would have made us feel a lot better, because, like I said, we've only ever wanted part of a solution here. And that's, you know, stop an outbreak in an Aboriginal community, stop the numbers from rising. If they would have listened, wouldn't have got so high and widely spread through our community. Our opinion was valued back then.
Thanks, Monica.
Thank you.
Mary? Mrs. Renee?
Yeah, so I wasn't privy to the local emergency management committee 12 months ago, but this one I was, and at the start it was just made up on the spot, because I actually didn't know about the 12 months one last year. And but as Monica said, there's been no communication whatsoever in like the community coming together and trying to put together, you know, any kind of plan on what we needed to do to help each other. I work in crisis accommodation, so I basically just waited for the phone calls if anyone needed to self-isolate to be ready to be able to, you know, just support through motel rooms. But of course, then everyone became fearful there. So with the local emergency management committees this time, it was made up on the spot. A week later, Health then became involved in being a part of a meeting, and then decisions were put back on the community to where they wanted to self-isolate, whether it would be out of town or in town and things like that. So when it comes to decision making, it seemed like there was a lot of no one wanted to take responsibility for it. And when the decision was put on the community, they felt, you know, we're right in this crisis. We don't know what to do. It's already been happening in other communities. They were expecting Health to lead and come up with the solutions. And once after that meeting, once they went away, once they got community to say, you know, we want you to take this decision, do something about it, we then started to see the rollout of the temporary accommodation, the base camps and everything set up. And but yeah, right at the start, there was nothing that that was of a plan that we could all work towards.
Councillor Lynch.
Yeah, I can only reiterate and agree with what our two ladies have already said on this matter, but I do want to make it clear that not all local emergency management committees work the same. I have several throughout my region, which goes up to the Queensland border, across the Dorrigo, down to Singleton, back out to Coonabarabran, and the representation of Aboriginal people is not consistent on those committees either. So in my backyard, I know that I don't have Aboriginal input into a couple of those committees in my region. And I was only talking to a CEO of a lands council last week who advised me the one he sits on barely meets. And again, it comes back to, again, we can have all the planning in the world down. It's about when the lever is pulled and they need to be activated. Then that's when community need the answers and they need it in a timely manner. The big one that it's another example, because I like using examples. We have a community, so I've got two communities that are using their own reverse barriers. So they've put in place plans, they're both reserves, and they've put in plans which they don't need the health order to stop, you know, them dealing with the crisis at hand. They've said that they'll control themselves by putting in what they call a reverse barrier, and they dictate in that plan the movement, who comes and goes, in line with, obviously, as the health orders grew. But more importantly, they've identified isolation. But a point that I'm trying to make here is they've identified it, but the accommodation that they've identified needs to be fitted out. And when that question is asked of the local emergency management committee or asked of government, it seems to be no one has an answer on how that could be resourced. So we've got a community that's taken the responsibility. We've got a community that's put in a reverse barrier, and they've come up with initiatives on how they could self-isolate if required. But they're scratching around now trying to get an answer on who can assist them with the basics of, you know, having the appropriate bedding, linen, the other bits they need to enforce that if there is a community breakout. And that community, one of those communities, has 250 of our most vulnerable people living there. So they've shown that they're prepared to take the responsibility. They've shown they're prepared to do the planning. But when the lever is pulled, how do they get activated? And I think that's been highly raised here today by the community members as well. So that's one of the issues we have, is how do we get those resources activated in a timely manner to address these needs?
Thanks, Councillor Lynch. Madam Met.
Thank you. I think for me, our local emergency management committee has good representation, is working well, but I don't know if that was the planning end. I think the biggest issue, looking at it as the mayor, is the preconditions before this pandemic emerged. And, you know, for me, it's one of, you know, the poor housing, you know, the disconnect sometimes for services, the lack of ownership by some services, what's their responsibility? If I say again, is that there was a time only a couple of weeks ago, we couldn't get vaccination data because everybody was passing the buck to say it was someone else's responsibility. You've got to recall that, the biggest conversation I was trying to get data was that the Royal Flying Doctors Service had the responsibility for vaccinations. Nobody took the responsibility that that for any person presenting to a health service, it should have been their responsibility that their client, consumer, whatever the language you use, patient, should have been offered vaccination. But I just want to go back to saying about that, the preconditions. So the Emergency Management Committee is sitting there ready to roll out food, welfare services, the housing, as Wilcannia got. Why, we still have to ask, why do we have to drive 30 motorhomes to a community? The preconditions are the important elements that we need to look at. The lack of funding to reflect the special population and the demands of remoteness. These remoteness that we see in the community, the fluctuation between drip feeding to outright deep cuts and desperate, despite the best efforts of the local staff, services have been in decline for years. So it shouldn't be a surprise why we have an emergency. And I just want to, although it's not in conversation today, but recognise Burke and Walgett as well and Dubbo. These are areas that were deep cutted funding. And so all of a sudden you see this emergence of this pandemic, and then go back again that, I think there was a comment made rather by the Premier or the Chief Medical Officer about we're on a super highway, we're in a fork in the road. And I could see that while we were watching this pandemic spread from Bondi to Western Sydney to Penrith, that this virus was on a super highway heading to the most vulnerable communities. And still to this day, we have no checks on public transport for people getting on public transport coming to Wilcannia, to Broken Hill, to Burke. It is not so much what is the Emergency Management Committee doing, but the preconditions and what is government doing to look after these communities, not in the last couple of months, but in the years leading up to it, because in a lot of ways, there's deep cuts to the funding, the disrespect these communities are being given, the lack of planning has made them vulnerable, and the government needs to say, this is what we did, not what we're seeing on the ground for these current emergency management committees that are trying to deal with the lack of funding, lack of planning, lack of investment in the most vulnerable communities. And really, again, as I say, this should have been stopped at the beginning, yet somehow nobody was seeing those emergency levers. They should have been putting on the red lights when it was in Bondi, when it was in Western Sydney, and certainly to this day, there is no monitoring of people travelling around regional areas, and there is, just starting to look at the vaccination programs that needed to be looked at well before this month. Thank you.
Thanks, Madam Mayor. The decades of underinvestment in First Nations communities have put in place the underpinning of this crisis, I think. I'll now go to Ms. Kate Fairman.
Thanks, Chair, and thank you all for appearing today in what we have already agreed is an incredibly stressful, busy time. I just wanted to touch firstly on vaccinations, and this might be a question for you, Mayor Turley, in the first instance. just going back to July, so on the 28th of July, that was when the New South Wales government announced it would redirect 40,000. It was redirecting Pfizer vaccines from regional New South Wales to HSC students in Sydney. I understand then on the 29th of July that the Far West Local Health District advised that they will be pausing any bookings for the administering of Pfizer vaccine at its clinics for at least the next 2 weeks, after which the direction will be reviewed. And they said anyone currently booked for a Pfizer vaccination first dose will be contacted and rescheduled to a future date. I just wanted to see like what impact that had if the council was consulted, and whether you're aware of Aboriginal people within the Broken Hill area and of course elsewhere that had their Pfizer vaccinations cancelled at that time because they were sent to HSC students in Sydney.
Thank you for the question. And can I say, when we heard that announcement, I was quite shocked. You know, our absolute, I want to recognise that the pain that Western Sydney is in, and also recognise, and I have to say this, is that on the weekend, I was shocked to see, you know, the numbers of people on Bondi Beach and other beaches while Western Sydney is still in curfew. And there wasn't really any conversation with local government. We were just told that these vaccines were going to be relocated. I don't think anybody thought, oh, wait on a minute, what's the local vaccination rate for Wilcannia and Broken Hill, or Burke or Walgett, or those communities? If their local vaccination rates are only between 30 and 39% double vaxxed, and I've got to acknowledge here, we do not know, I do not know, and you know, I absolutely agree. I don't know what the Aboriginal vaccination rates of double vaccinations, or I just know the general community ones, so let's acknowledge that. There wasn't a conversation, there wasn't an option. The data is was quite a struggle for me, because I believe data's gold, and you know, if you know what your target is, then we can increase on it. But all of a sudden it was announced. I think there was a thank you by the Premier thanking us for giving the vaccinations, that, you know, but we weren't asked, we weren't consulted, and I don't know how we caught up, because I spoke to the administrator from Central Darling, Bob Stewart, and he raised the concern, how are we going to catch up those doses? Because it's okay to say you're getting them back now, but how do you catch up those 2 weeks plus, or whatever it will be, of vaccinations? And, you know, because you've only got so many staff on the ground. And again, I'll go back and acknowledge that, you know, it is really hard to retain and attract staff to these rural communities. So our staff are already overworked, and how do you actually make more clinic hours when you've only got so many staff on the ground? So they weren't discussed. I'm sorry, my dog's trying to jump into this.
Yeah, that's okay. Your dog's very cute. It does once a week. Can I just check, Monica, whether thanks, Mayor Turley. Can I check, Monica, whether there was any impact in Wilcannia that you can talk about in terms of that vaccination cancelling appointments to send those vaccines to HSC students in Sydney?
You know, my understanding of all this vaccine rolled out in our, there was a lot of lack of understanding around it. You know, the AstraZeneca was the first vaccine offered to our community, but people feared the side effects of that because of underlying health issues. Then AstraZeneca was offered through the Royal Flying Doctor Service, and the Pfizer, sorry. And, you know, a lot of people lacked understanding of it. The thing we needed to understand was, is it going to already affect underlying health issues that we do have? You know, we've asked at a community level, well, I've asked at a community level for our health services on the ground to go and give out information to the Aboriginal community on these injections, you know, on these vaccines. And then when Pfizer did, the Pfizer one did come out, you know, there was still that fear. So there was a lot of fear around having either injections, you know, and there was that lack of information given to our people on the ground. So that, you know, me personally, I haven't had the injection. I'm not having them because, you know, that's my choice. But people, you know, some families do have real, you know, underlying health issues there that they needed help to give them understanding and allowed them the freedom to ask that question. But it was too, you know, the rollout of all of this was too late. You know, 12 months too late, 6 months too late with all the vaccinations. So,
Monica, can I jump in and ask you, sorry, can I, just as you're talking about this in terms of it being too late, I did want to follow up on the video that you posted around, it was like from a story, telling the story of the 30-year-old Barkindji woman with breathing difficulties who was turned away from Wilcannia Hospital. You posted a video of that, and I understand that quite a few people saw that video. Firstly, what was New South Wales Health's response to that video? What action did they take? And I just wanted to check on whether that woman was okay and is okay now.
she is okay now, thank God. The time that it happened and the night that it happened, she already had breathing issues long before COVID hit. So, you know, to then get COVID and pneumonia on top of that was very scary for her. When she presented at the hospital, like I said in my video, she felt like she was being treated like a dog and left outside. You know, and the response to the health service, very appalling because, you know, the rules were changed when a COVID tested positive person enter an ambulance, that they sit inside the ambulance outside of the health service until they prepare a room. Now, there was no room prepared. There was nothing prepared for anyone really, let alone this young mum. All she wanted was just some oxygen, you know. She was talking to him, so, you know, we don't know the full horrors of how COVID could hit the body, except that people have been dying from getting COVID. So for this young woman to present at a health service and then asked to sit outside, you know, even outside of the ambulance, left alone to wait till they called RFDS to isolate her somewhere or to even attend to her. You know, I was angry because her brother rang me. She didn't ring me. Her brother rang me in tears and said, you know, well, he was tested positive and he was in lockdown. Now, they're very close. He was going to walk out and go up to the health service and he was going to yell at somebody, you know, and I said, no, just calm down, son. I'll ring somebody, find out, you know, what's going on. Then he rang me back out.
Sorry, Monica, I hate to interrupt because I hate to do that, but I only have 1 minute left of my questions. So I did just want to get one more question into you as well about Wilcannia and what's happening in
back to this.
Oh yes, so no, if you wanted to finish, please continue.
No, it was appalling the way health treated this young woman, and it was one woman. And thank God she's alive and doing well today.
Thank you. Can I check now in terms of the people in Wilcannia who need to be isolated because they're COVID positive? Is there enough accommodation for people? Are people who are sick in Wilcannia with COVID, do you think they have everything they need now?
Well, yeah, everything that health put out there for them with their slow response. But, you know, a lot of people feel that, you know, they've let them down. So, you know, like I said to earlier, was the accommodation and everything was a slow response to a pandemic in this Aboriginal community. So people feel that they don't trust anybody, government, including health. Health has failed our community on all levels. So in a response to a pandemic in a vulnerable community. So, you know, we don't trust anybody at the moment. Our lack of trust towards government, you know, on level, we just don't have that anymore.
Thanks, Auntie Monica. I might go to Councillor Lynch and then to Mrs. Renane. Could I ask you, in terms of getting through to communities, the message about the need to vaccinate, the benefits of vaccinating, you said, Councillor Lynch, that there hasn't been the investment in communications focused on local communities coming from Aboriginal controlled health organisations. Is that a missing part of the response, and how do we fix it?
I think absolutely. You know, our people want to hear from our people, and whether they have the vaccination or not, at least having the right information and being informed. They trust Mob in you know, putting forward that information. The other thing I do want to note in relation to vaccines, if I could, David, and I will come back to the AMSs on the ground because this is pertinent, is that even today with Visor, you know, the supply of Visor to even the Aboriginal medical services, who are doing a great job, has been inconsistent. So if they're on a fortnightly distribution of Visor, in sometimes, and I've spoken to several AMSs where that's been pushed then out to 3 or 4 weeks on supply. So you can imagine what that's doing to coordination of vaccine clinics for those that wish to be vaccinated. That all takes resources. Once those clinics are scheduled, they then need to be rescheduled, and then obviously getting into community. The other issue we had with the vaccines wasn't, even when they were available, was getting our people to them. And we had people that had to travel into Dubbo, where we had an outbreak for vaccinations. That's just absurd. So, you know, I think, you know, that it's an area that needs to be improved greatly. But it's an area, as I say, it's about making sure people get the right information, are being informed. And I can only, again, speak, I know that in my region, 2 AMSs are well over 5,000 vaccinations now, whether it's AstraZeneca or Visor. And that's all happened in a space of 4 weeks in the reality of things. And in relation to vaccines, the other thing I will put out there, it just comes back to directly the communications, because, you know, the basic example of this is, can someone please tell me if they've received any documentation in the mail around vaccinations for COVID-19? Because the last time I looked, we've spoken about the internet, the lack of NBN services in our remote communities. You don't have to be that remote, because Wahola's got these issues. It's 74 k's from Tamworth. The moment they step outside the school gate, they don't have, you know, the children can't do homeschooling because there's no access. You know, and these are the real issues that are at hand in our communities at the moment. So, and these matters have been raised 18 months ago, where there was committees put in place to look at food security amongst our remote communities. There was committees put in place to look at infrastructure. And again, today we're sitting here with these same issues. So COVID is one thing. The compounding issues we have on top of that is, you know, homeschooling. You can't be homeschooled if you've got no access to the homeschooling sites. And again, our telecommunications issues. But in relation to the Visor, what I have seen, David, when our Mob are being informed by our Mob, they at least are trusting that advice, and they at least are making informed decisions. Again, those that may not wish to have it is their choice, but I've seen a remarkable improvement since that information has been given, administered in the hands of Aboriginal people.
Mrs. Renane, from a Wilcannia perspective, have the resources been put in place to allow trusted local Aboriginal organisations to be getting the messaging out about vaccine with locally tailored messages that the people will trust and listen to? Is that part of the response?
They are now, but not at first. We were left with the same information everybody else was at the start. It was just about social distancing, hand washing, keeping surfaces clean, it being airborne and things like that. That was then the vaccination. We had the rollout of the army, the authorities to come to town and then the fear tactic of the door knocking, which is what we have now. There is with the local Marama Health, there is a doctor that comes along with the other health workers to be able to administer the vaccine. But as Monica said, and we have not had any information, and Charles has touched on it, about just not having any information about what the vaccine actually does to our bodies, all of our individual underlying health issues. There's nothing that was given, and even like where we're having conversations with doctors now, it's still yes, and then there's still people saying no. So there's still a lot of confusion of what we need to be doing. Daria spoke about that there's data that's saying that we should be more confident in the vaccines. On top of all of our own confusion, it affects our human rights. As Aboriginal people, we have always had to struggle for our human rights, and it seems that this is just another way that we're losing more ground, and people struggle with that as well. They struggle with, I've just got to step in line and do what everybody's saying. As much as we're in the pandemic in Wilkenya, there's been people that COVID's missed, but no one's not taking that into account. It's just like there's strong people. There is people that's had it, and their immune system has fought it, and they've come through. But the fact is, you've got to have a dose. You've got to have double doses, and that seems to be the strong message always. And but no, there's not been a lot. There's the people that I've spoken to, not only in Wilkenya, but other Aboriginal people, they are just very scared of, what can happen once they have the needle.
And the way
Myself,
to break.
personally,
Sorry, Mary,
Yep.
you go.
Yeah, I was just going to say, just to add on what Monica said, I've actually had one vaccine and waiting for 3 weeks for the next one. So it's not that I'm against it. It's just that I wish I had more information. I want to say that even having the vaccine didn't make me feel good. It just made me feel worse, because it seemed like it was against everything that about me and my rights.
Can I ask you, in terms of the supply, Councillor Lynch was pointing out that the Pfizer supply is still not there in the quantity needed. Can everybody get a vaccination as soon as they need it in Wilkenya? Is there the supply in place?
There is. So there's so they have 4 days a week that you can go and get vaccinated. 5 days a week you can go and get tested between certain hours. Royal Flying Doctors administer. But yeah, and Marama Health is now doing door knocks. So I don't think there's a shortage.
In terms of the housing, I mean, Monica, you were talking about the anxiety about when the mobile homes are going to be removed. What COVID has shown is this chronic lack of housing in Wilkenya, and it's not limited to Wilkenya. Are the community making the call that they want the mobile homes to be retained permanently until there is that further investment in housing? Is that part of the call in Wilkenya?
I think so. Like right now, we need something put in place to ease the minds of a lot of people. But we do need more housing. Families are growing here, and some of them do want their independence. So yes, if that is possible, but I'm hearing how much it's costing them to keep those mobile homes here, when we could already be in the process at least 2 years ago in building more houses in our community. Health is, their businesses are prosperous and around here, but trying to isolate families is very, very hard, and they don't want to leave their house. No, they don't want to leave their own. You know, we have an overcrowding problem because we won't see our people out on the street. We won't see, we don't have homelessness here in a sense that cities have it, but we do have an overcrowding issue here. That has been an issue for years and years in this community. So keeping the mobile homes here until we, you know, they decide to build housing for the people would be a great idea, and it would be welcoming, unless it's not being policed or anything like that. You know, that after, you know, the plan, we don't know the next plan. We don't even know what sort of plan is on the ground.
Thanks, Auntie Monica. And then that uncertainty in the community right now, uncertainty about where COVID's going, uncertainty about what the response is, because you're not part of the decision making. Is that right?
No, and nothing's getting fed back down to grassroots level. That's my point, that they meet every day. They have, you know, LEMCs at a LHD level as well, that nothing is being filtered back down. It's a, you know, top down, bottom approach here, and it always has been that in our Aboriginal communities. You know, like I said earlier, we only want to be a part of a solution here. And, you know, what better way than to have grassroots people living in community on the ground in these situations, overcrowding, to be a part of a solution. But it's a top-down, bottom approach, and it's a wrong approach, especially, you know, from government to its Aboriginal people, first custodians of the land.
Thanks, Auntie Monica. We are fast coming to the end of the time we have for this session, and I'm so sorry we haven't had the time we need. I'll hand over now to the opposition.
Thanks very much, Mr. Chair. And can I just also, my name's Courtney Housos, I'm one of the Labor members on the committee. Can I thank all of the witnesses today for your time and for your very valuable testimony. As the Chair said, we have got very limited time. I just wanted to ask some really simple questions, particularly to you, Auntie Monica, about, you talk about overcrowding. We know that it's really, that the main source of transmission in this Delta outbreak has been within households. What's the average size of a household that we see in Wilcannia that you would see within the Aboriginal community in Wilcannia?
Well, in my household, I have 6 children, right? But I don't have that overcrowding issue like a lot of the families do, because my children have moved out, got families of their own. But you're looking at, you know, from a grandmother to youngest baby born, you're most likely looking at 10 people, you know, living in one household, in a 4-bedroom house. So 4 bedrooms for Aboriginal families is not adequate housing. You know, it's not, they're not looked at for the larger families. And, you know, I don't know, people just feel that, you know, we need more houses and ones that are going to look after everybody. You know, even if a family doesn't want to move out because of whatever reason, and financial reasons is a big issue. Being unemployed is another issue around moving out, you know, and finding somewhere. And then it's the lack of housing, whether it's private or Aboriginal or whatever housing management is in this community. There is mainly a big lack of that. You have to be working. When you work, get a job, you have to get a government job. So whether they put you in their housing is a different story, but not enough Aboriginal housing on the ground here to cater for the, you know, huge families that we do have now. So not many houses, you know, that where our Aboriginal people can move out and move into another house. There's not that on the ground here.
Yeah, and that was really powerful testimony that you gave us early on, to say that the temporary housing came so late that COVID had already gotten into those large households. When you have households of 10 people, it is likely that the figures right across the state show, once it gets in, then it's likely to spread within those households. Thanks very much, Auntie Monica. Mrs. Renee, can I just ask you one question just around the housing availability in in Wilcannia, we know then if there were big households, we needed to have somewhere to remove them to, and there was just nowhere at all for them to be removed. Is that right?
Absolutely. So, in preparation, before COVID, the only temporary accommodation that we had was a motel, and and any breach of any home where there was 10 or more, and they needed to self-isolate, there was just never going to be a place that we could be able to accommodate them. There was just nothing. We've got in Wilcannia, and I brought this to attention before, not here, but we have government houses, police housing, and teachers' flats that's vacant and remain vacant for long periods of times, and they were vacant throughout this time, and so it's we have solutions on the ground, but the decision makers and the people that we have to talk to don't come to the table, don't want to hear about the solutions that we want to put forth, and so that's a sad thing as well. So but yeah, just going back to the question that you gave to Mon about once they leave, we're back to square one. We're back to relying on a motel and the crisis accommodation that the Safe House provides, which is now, because our core business is domestic and family violence and homelessness. It's just there's just nothing. There's not enough.
Yeah, absolutely,
And
Mrs. Renee. I'm really sorry. My time's sorry.
Oh.
My time's about to expire, and I can see Auntie Monica's got her hand up. She wanted to just add one final thing. So I'm sorry to cut you off. Our time is very limited today.
Okay.
Sorry, I just need to say that the accommodation that was offered to the community during the outbreak was either through COVID tested positive or domestic violence, which we felt was very, it was degrading to know that, okay, I've got COVID and then sent back into overcrowding house COVID, but the only way to isolate was either tested positive or domestic violence, which, as far as I'm concerned, ticks all boxes in our small community around isolating families. That was offered by ALP. When I rang somebody and said, need to get a young girl out of one area into another, they said, is she in DV? Well, she's living in an overcrowding house, stuck in with COVID tested positive people, and naturally emotions run an eye, fear run an eye, and anger on top, that they couldn't get them out of the house quick enough into any of these available accommodations. And a month later, they roll into town with, bells and whistles with 30 mobile homes when COVID has already run rampant through our community. So, just on what Mary's saying, the accommodation is now on the ground, but it's a little bit too late, as far as isolating people. And we need permanent housing put into this community, not a quick fix and an expensive band-aid, what the Mayor of Broken Hill said. These are just quick fixes at a time to tick a box to say they've supported the community.
Thanks, Auntie Monica.
Thank
Monica.
you.
I'm going to hand over to Kate Fairman.
Thanks, Chair. I just wanted to go back to you, Mrs. Renee, in terms of Wilcannia Safe House, and just whether the Delta outbreak has impacted accommodation at all that is available for women and children, particularly trying to escape domestic and family violence. Is there enough accommodation in Wilcannia? Is Wilcannia Safe House able to still have that accommodation available?
No. We have right now we've had 2 units that we've had COVID's impacted on, just been able to make those available. because we need to go through the processes of, because we had 2 residents relocate, and we needed to go through the processes of having the repairs and maintenance and the cleaning. Because of COVID and the lockdown and the outbreak, we can't get anyone to come to town to do the cleans or the repairs and maintenance. Just in regards to having the properties maintained for any COVID clean and things like that, it's impossible to get anyone to want to come to Wilkenya, and that's, so it has impacted. But in regards to domestic and family violence, we have been working with lots and lots of women of having safety plans in place, and the way that we work is they actually, you know, it's about them acting themselves on what they need to do, but it has limited to fulfill some of those safety plans where they needed to fulfill their safety plan. So where they needed to escape and they needed to have some time out, that place no longer exists while ever there's COVID and the crisis accommodation is full. So but yeah, we've worked with many women of the community to have safety plans in place for them to protect themselves and children, and you know, to reach out, and we have a lot of strong women that have no problem of reaching out to the police if they need to call the police. So that's what we had to go back and rely on, because there's nowhere for them to go.
Thank you for everything you're doing on the ground and your organisation is doing. My time's up. To go to the chair now. Oh.
Well, yeah, thanks, Ms. Fairman. We have run out of time. It's now hit 11 o'clock, and I'm sorry, that's when this panel concludes. Can I thank all of you, Auntie Monica, Mrs. Renane, Mayor Turley and Councillor Lynch, hearing directly from you about what's needed on the ground, the need to prioritise Aboriginal controlled health organisations to get the message out, the need for the desperate need to be planning ahead, the desperate need for accommodation on the ground. And can I just commend all of you, whether it's at a council or a lands council or a community organisation or a community group, the work you're doing to keep your community safe. It's inspiring to all of us. And we thank you for the time you had today. So we will now have a short recess until 11:30. Could I remind all committee members that it's probably best to stay online, but it's also probably best to place yourself on mute and to turn off the camera, unless you want people to have an insight into your domestic affairs over the next half hour. So again, thanks to all the witnesses, and we'll come back on live at 11:30.
Hi, Miss Spencer. Hello. Hi. We'd just like to do a quick test of your audio,
there.
please. Hi,
Yes, can
great.
you
Thank you
hear me?
very
Hello,
much.
everyone. Thank you.
We can see you and hear you fine. Thank you.
Excellent.
And just with Mr. Malouf.
Yep, can you hear me?
Wait, Dr. Malouf. Yes, I can hear you and see you. Thank
Great.
you. And we've got Miss Shana Keel.
Yep, I'm on here, thank you. Sorry, I had to dial in by a phone due to reception where I'm located.
Okay, no problem. We can hear you very well. Thank you.
Thank you for doing that, Helen. Thanks again for coming, all three witnesses. We're now resuming the hearing of the Public Accountability Committee's review of the COVID response by the New South Wales Government. We're very fortunate to have these three witnesses for the next panel. And I might just invite each of you in turn to give your name and your title, and then take either an oath or an affirmation. Dr. Malouf, we may start with you if that's okay.
Sure. Thank you. So Dr. Peter Malouf, Executive Director of Operations for the Aboriginal Health and Medical Research Council, I solemnly and sincerely and truly declare the affirmation that the evidence now about to be given by me shall be the truth and the whole truth and nothing but the truth. Thank you.
Thanks very much, Doctor. Ms. Watt? Sorry, Ms. Quayle. It's Ms. Quayle next. Ms. Quayle?
Thank you. So my name is Shana Quayle and I am the current AHNMRC COVID Response Coordinator, and I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thanks very much, Ms. Quayle. And Ms. Spencer?
Hi there, my name is Wendy Spencer. I'm the Project Manager of the Darri Elders Group in Walgett, and I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thank you very much. And just for the record, we've had a late apology because of urgent business, pressing business that Ms. Waters had to deal with, and she extends her apologies to the committee. Dr. Malouf, we may start with you and give each of the three witnesses, if they choose, the opportunity to make a brief opening statement, and then we'll go to questioning, starting with the opposition. Dr. Malouf?
Sure. Look, I would like to just begin by just acknowledging the traditional custodians of the land that we are working, and also respect the connections to land, water and community. And I pay my respect to the elders past, present and emerging who care for and continue to care for community and country. Look, I thank the committee for allowing us to speak today. The AHMRC is the peak body that represents 47 Aboriginal community-controlled health services across New South Wales. And our core focus is about advocating for the health equity while supporting our members in delivering high quality and comprehensive primary health care to individuals, families and communities. In speaking before the committee today, we will present AHMRC's views on the New South Wales Government handling of COVID-19 crisis as it pertains to the Aboriginal community-controlled health sector. Thank you.
Thanks very much, Peter. Ms. Quayle, did you want to add anything to that at this stage? I think we might have briefly lost Ms. Quayle, so I'll go to Ms. Spencer. Wendy?
Oh, thank you. Yes, I want to acknowledge that I'm speaking to you from Gamilaroi country today and pay my respects to elders past and present and the current and past custodians and to those of the lands that you're meeting with me from today. I'm the project manager of the Darrywa Elders Group, a non-Aboriginal woman working for an association of Walgett Aboriginal Elders that's been in existence now for over 20 years. We're an association of Aboriginal elders and their staff supporting elders to further their work in the promotion of wellbeing, community development and Aboriginal cultural heritage promotion and protection. And we've learnt from over 20 years of engagement with government and advocacy efforts that ACCHOs, by their nature, understand their communities better than government agencies and their personnel, who have a high churn and rarely devote resources to where they are needed in the quantities they are needed in for the longer term. By their natures, government agencies also can't be flexible in their responses. Any organisation dealing with an emergency needs flexibility and backup from skilled teams. We in our organisation are in a partnership with the University of New South Wales. So we're in the unique position of being able to access best practice research to explore solutions to back up the solutions that are generated locally. It means that our small team on the ground can be flexible as we are graced with a flexible funding pool, hard won from private backers. We only receive a very small amount of government funds at the moment. We know this is unusual and we're extremely lucky. It's only short term and finite at the moment. With our unique partnership, we're starting to attract the resources we need and so have expanded our staff who are engaged daily with community cohorts, young people by our youth team, alcohol and other drug clients by one worker that we have who's an expert in that area, and elders through our Elders Social Support Program. We're evaluating and documenting as we go so we can prove to government that resourcing activities like ours are worthwhile. So we can prove that approaches such as ours that are local, place-based, flexible, holistic, that are centred around and prioritise people and their wellbeing and the wellbeing of their community are the way to go in emergencies. I think that's called public health. So we have the relationships and regular contact with community and so have the understandings of community needs. And also we recognise the long-term systemic issues that are really exposed during these emergency times. Our experiences and learnings come from responding to floods, to the burning down of our supermarket, to the rivers drying up, which affected our drinking water and food security and daily living practices, as well as the COVID emergency. And we've been first responders in those emergencies alongside the other sort of official first responding agencies. Government agencies are slower to respond. As I said before, this is particularly true in country areas where their agency staff churn and their experience is very tenuous. We're often made to feel like we're criticising them. They get defensive when we're bringing up our experiences and community needs in meetings and in our advocacy work. They get defensive because they can't do much within the narrow guidelines of their jobs and the small sort of piecemeal services that they work in Walgett. But we're also not resourced to respond properly either. So that, you know, there's difficulties with us as well responding, but they're different. So as an ACCHO, we have no status in an emergency. We can only advise the official agencies within the regulatory framework of responding to emergencies. I'm realising more and more that there's an Aboriginal emergency network that must be recognised and resourced appropriately. And that's the main network that we rely on to respond in the first instance to an emergency. I've grown to appreciate our Leocon, Trent Swinton in Walgett. I've observed him fearlessly speaking to Minister Hazzard last week in Walgett regarding our needs, and he's responded pretty well to our requests. You know, I've noticed that his learnings have developed over the time that we've been together in the LEMC meetings. I think his respect for our service and WAMS, the Walgett AMS, the other ACCHO in Walgett, an understanding of our services and our community has grown during these emergency processes. He's been able to keep a clear head and use his position to communicate up the chain of command to the REACON and the CEACON most of our pressing issues. Where we haven't received any traction, I think, is specifically related to sort of entrenched assumptions, cultures and systems embedded in New South Wales agencies, and sometimes the politicisation and sort of, you know, a different understanding perhaps of what public health is and how important it is for all of us to prioritise it. So I've got, you know, there's some super like current issues of concern. We've got 5 new cases in Walgett now. Over the last 48 hours. Immediate concerns are that, you know, improvements are needed with the pathology COVID testing capabilities. Speeding up the results from them would lower the spread of the virus. New South Wales Health is meeting this need with applying more couriers to transport the swabs to Dubbo pathology. That's their current workaround. Also, telecommunications are dropping out. You know, NBN could be better, but also in the smaller communities, they're having problems with Telstra, just sort of dropping out. There's some hardware issues somewhere. I have a little list of some of the issues that we've brought up with yourself, David Shoebridge and Roy Butler, our MP, and other New South Wales and New South Wales agencies, like we wrote to the Minister for Education back in 2020 about our concerns. Do I have time just to quickly list them, Mr. Chair, or should I?
Well, what I think we may explore that through questions, and I'm sure there'll be an opportunity to deal with them through questions, Wendy. And
sure.
And because I think if we get into questions now, and at the end, if there's anything you feel like we've missed, feel free to make sure you put it on the record. But I will hand over to the opposition now for the first round of questions.
Thank you.
Thank you. Thanks very much for making the time today. Last year when we were in this position, the role of the Aboriginal controlled or health organisations was lauded as really protecting community, having the flexibility to be able to do the things that were necessary to keep the virus out of their communities. And I think it was very well recognised. My concern is that obviously with this second round, this new wave of the pandemic, when we knew that it was, you know, far more contagious, that there just seems to have been a real dropping of the ball in terms of the planning and the involvement of Aboriginal controlled organisations through what's happened, and now we see the really serious consequences of what's happening in Western New South Wales. I suppose it's a question to you, Dr. Malouf. I mean, there've been such excellent work done last year. What sort of happened with this year? from your perspective, and to find ourselves in this position?
Yeah, look, thanks for the question. So I think from my perspective, and particularly from the sector's perspective, is that, at the beginning of the year, our focus was really about vaccination, right? So about vaccinating our communities, but also, working through the multiple changing information about the vaccination rollout. Certainly, we had members that expressed concerns to both state government and the Commonwealth about, planning for a particular emergent of the variant of concern, which is now Delta, that is impacting communities. And so, 18 months ago, the reason why we saw relatively low numbers of cases in the community was that we were prepared, we planned, we worked with multiple agencies to stamp out the Alpha variant of concern. But now with Delta, I guess we've lost, that partnership and coordination with both levels of government around controlling the outbreaks in communities when we were focusing on, the rollout of the vaccination program. So I think that's, at the beginning of the year, that's what we saw as the ball that was dropped, that was missed, and that we needed to fix it immediately.
Can I just follow up with that? I mean, it seems to me that it's, obviously the vaccination rollout was a Commonwealth responsibility. It appears to me that there was quite a lot of sort of, buck passing in terms of who was responsible for that, rather than doing whole of community planning, which was necessary. I was very concerned to see the Health Minister at one press conference suggest that the issues in Aboriginal communities were a matter for the Commonwealth, and that somehow the state didn't have any responsibility there. That's clearly wrong and problematic. Is it, obviously the vaccination rollout was an issue, but is it just also the case that really sort of on the ground that the state agencies really just took a step back and left it there? Is that sort of what happened, and now they've been playing catch up? Is that sort of your reflection from your organisations? And I'm happy to put that to Ms. Spencer as well.
Yeah, look, certainly we are in a phase of catch-up, right? So what we see both from a state level and a Commonwealth level is national planning, right? We don't see localised planning with our Aboriginal community-controlled health services, who I keep on saying have, 50 years of experience rolling out immunisation programs across their local communities. So we see that our ARCHOs, our 47 ARCHOs across New South Wales, run successfully influenza and pneumococcal immunisation programs seasonally. Why is COVID vaccination rollout any different? The planning and execution of those programs would still apply to COVID. So I don't understand why ARCHOs weren't at the table in terms of that proper planning. But at the same time, talking about, we knew that there were variants of concerns that were popping up across the world. And we will see another, there's another 4 variants of concerns that have been identified by the World Health Organization. We really now need to be thinking about, well, what is the planning for those variants that may, if we, go with this vast opening, which we have now seen at the moment in New South Wales with the lightening of restrictions. If we were to open the borders for international flights, what about if that variant came into our communities when our communities are already suffering with this Delta variant at the moment? So there are things that I'm concerned about and our sector is concerned about, is that we need to do some serious planning before we do vast openings across the country.
Oh, and just for the Hansard's benefit, ACHO is the acronym for Aboriginal Controlled Health Organisation.
That's correct,
right.
David.
Sorry.
Yes. And sorry, Dr. Malouf, do you see that? I mean, are we ahead of, given we're playing catch up with Delta and the very important issues that you raise, communities as we're rolling, as we're opening up, are you seeing that kind of active planning, or are we still just in the crisis mode of Delta?
I think we're in still the crisis mode of Delta. So, I guess we need to consider the current situation in our neighbouring state of Victoria, given that they had another 490 odd cases today. And so I would be concerned that that our outbreak measures are not being controlled enough if we are moving towards softening of restrictions. I think we need to revisit that. What I would like to see is that our Aboriginal communities are at the table of those public health responses, but also at the table of deciding when to open up New South Wales to the rest of the state and territories.
Ms. Spencer, is there anything you want to add to that?
Well, I fully support what Dr. Malouf just said. They need to be, HOs need to be at that decision-making table, and too often we've seen at the local level, Dr. Malouf sees it at a higher level than I do, just down in Walgett, so he's aware of what's going on at all the AMSs. And also, I'm not speaking on behalf of the Walgett Aboriginal Medical Service either, speaking as an observer in a community, but having grown out of the AMS here, because our service actually was a program of the Aboriginal Medical Service to start off with, which we're very proud of. So we do have that wellbeing and public health ethic. Too often we're not privy to the sort of war gaming, the sort of thinking through, okay, so if this happens, what does that mean and how are we going to respond to it at the local level? We don't get to do that war gaming, and we've asked to do that, and we're a bit surprised that it sort of doesn't, it hasn't sort of gone on either. We're sort of assuming that, the big people at the national and the state level are doing that, but then we find out that when we're asking questions and escalating issues up from our LEMC, that actually they haven't all the time, and they're responding to things that we're asking them for. So we would like to be more prepared for future emergencies, and we've been saying this for a long time.
Thank you. I wanted to ask about the vaccination issues, but in particular, I mean, again, I think it's been very slow. I mean, I think, well, rightly, the community have been extremely concerned that Aboriginal people, as clearly identified as a vulnerable group with many underlying health conditions and the need for vaccination, that the low rates of vaccination, I mean, that was sort of before, and I know that they have ramped, there has been some ramping up of that, and there's some pretty, excellent work going on there. I am, though, interested in whether the sort of that really, people who really aren't even necessarily going into AMSs, that sort of outreach work in those very vulnerable communities, whether there's enough going on there. Dr. Malouf, or I think we've lost Ms. Quayle again, really keen to get your thoughts on how, clearly we've come from a very bad base, and that's a shame on everyone in terms of the prioritisation that should have occurred. But, what do we need to do to pick up from here?
Yeah, look, thank you. I think what we're seeing now with obviously tragedy with the outbreaks in Western New South Wales is now this real focus of ramping up vaccinations across New South Wales. So we're seeing obviously an increase of Aboriginal people coming forward to getting the first dose, but the gap still exists between Aboriginal population versus non-Indigenous populations. And so that gap's about 20% in terms of mob getting their first dose compared to New South Wales and more generally. But the most important thing here that we have to consider is how do we get mob to come back for their second dose? And so that's the huge gap that we're seeing at the moment, is that the second dose is very important in terms of getting that full protection. And so what we are doing at the moment with our Aboriginal community controlled health services is ramping up messaging around the importance of getting the second dose. What we also have to acknowledge here is that our Aboriginal community controlled health services are a family network, and they will support one another through every crisis. We see that with the bushfires, and now we're seeing that with COVID. We have a mass vaccination program that's happening in the northern part of New South Wales, with Bulga Nauru and Bullina Aboriginal Community Controlled Health Services, working with multiple partners in northern New South Wales to run a mass vaccination program. And they're seeing a large number of Aboriginal people coming forward for their first dose, which is promising. But we need to continue that work of mass vaccinations across the other parts of New South Wales to get that protection that our community deserves. But I guess the issue here is about communication. We know that at the beginning of the year, there was, information given about AstraZeneca and mob getting that over 60, and then obviously the information then changed in terms of different age brackets that could access AstraZeneca. And then, the second phase 1B came into play with then Pfizer, and then there was misinformation about that. And so mob are really concerned about the misinformation that's happening across the state. And so what we're trying to do as a peak body is work with our member services so that we can dilute some of those misinformation about those different vaccines that are on offer, and make sure that they're getting the right information and being well informed to be able to get the jab that they need to get that full protection.
And do you have access to the supply of Pfizer that people are preferring?
Yeah, look, we are working closely with the Department of Health through the Commonwealth to ramp out the Pfizer doses within our Aboriginal Community Controlled Health Services. So 47 ARCHOs are equipped with Pfizer as well as AstraZeneca. And with the current outbreak, we've seen an increased doses of Pfizer within our services to provide that large-scale vaccination program that's required.
Yes, Ms. Spencer, you jump in.
Yeah, thank you. Sorry, the phone's ringing. I just wanted to say, perhaps give you a bit of a case study. Here in Walgett, WAMS's vaccination effort was supplemented for a week by University of Newcastle nurses coming in voluntarily, flying in, plus Royal Flying Doctor Service nurses coming in and just increasing their capability. And so that allowed the team to continue their vaccinations at their base, but then also to go mobile, which was terrific. And that was the first time they were able to go mobile to the two reserves just out of town, but also, street by street. And we had a couple of elders that were really worried about the vaccinations because of their underlying health issues, a number of issues they have with their health. And so they needed to actually sit down with a doctor and just be assured that the vaccination was going to be right for them. And because they had the extra capability during that 1 week, the doctor had the time to sit down with those elders, and those elders subsequently got vaccinated by the mobile teams, or they came in and got vaccinated. And I was present when that happened, and our workers went and got them and that sort of thing. But, that only happened, I believe, or it would have been harder to do if we hadn't had that extra capability of those volunteers just flying in. Why isn't there like this flying in team like there is in New South Wales Health when there's a heart attack or something, and this heart team just flies in and diagnoses, triages, decides whether to take the patient away to somewhere else? There should be a sort of flying in team that does this and boosts up the capacity of the ACHOs when it's needed. And only the ADF seems to be deployed to be doing this at the moment. And we're hearing about really poor communications between them and the ACHOs, to the point where the AMS here is worrying about the second doses of people happening too soon, because they might go to the mass vaccination hubs that are set up by the ADF and New South Wales Health, and they've already received one vaccination at their first vax at the AMS, and they, because of the urgency and everything, they think, oh yes, I've got to get vaccinated really fast. And the communications between the two services aren't necessarily, they use different softwares, I believe, and there's a bit of a lag time with immunisation data being uploaded and different capabilities there. And so people get their second dose perhaps sooner than they should have got because there hasn't been that sort of careful checking or delineating between patients. Like, I think the AMS here is now starting to recommend that if you've had your first dose done with the AMS, then just wait until the AMS contacts you for your second dose. Also, the AMS goes to a lot of trouble to be tracking everyone down for their second dose. That's a lot of staff time involved in doing that, which is all wasted when the ADF come in and give them their second dose, and then the AMS doesn't know, and they're ringing them up and finding out, oh, you've already had your second dose. Oh, okay. So there's a bit of wasted effort or redundant effort going on there, which needs to be sorted out. So that goes to Dr. Malouf's point about communications between the services, but also, you know, wouldn't it be wonderful if the HOs had this extra boost of capability when they needed it and when they asked for it?
Jump in and ask a follow-up there. Dr. Malouf, how widespread is this kind of intensive work with communities? We know that there is some hesitancy within some Aboriginal communities, and we know the importance of the person delivering that message about vaccination, that if it comes from a trusted person like Ms. Spencer outlined, if it is the elders that have been vaccinated and can then share that message, that's so valuable, particularly within vulnerable communities. How widespread is this work that's actually occurring, and what additional supports are being provided by government? Because it's one thing to say that Aboriginal people are prioritised, it's another thing to actually do the legwork to make sure that actually happens in practice.
Yeah, look, thanks for the question. I think we have to acknowledge here is that Aboriginal people have historical issues with the health system. And so it's about the health system trying to respond quickly to make sure that they are delivering messages and obviously delivering the vaccination in a culturally safe and respectful manner. And that's where I think the hesitation has kind of started from, is the kind of mistrust and information that's been given by mainstream health system that's kind of amplified this kind of hesitancy within communities. And so, you know, we're working closely with our Aboriginal community controlled health services to be that primary point of vaccinations, so that they are coming into a culturally safe environment, and that the health professional that's delivering the vaccine is culturally safe and will respect the cultural needs of individuals that come into their care for the vaccine. So, you know, that's what we're doing on our health service delivery level. But on terms of a community-based level, is working with, you know, community-controlled organisations, as well as the Aboriginal land councils around targeted messages for targeted audiences. We know that, particularly in Western New South Wales, that majority of the cases are quite young. And so, you know, working with those respective organisations to ensure that those messages relay to those specific target audiences of young people. And so we're working closely with those organisations to do that. But, you know, ultimately here, the issue is really about communication. And what we've seen over the last you know, the start of the year is this poor information communication around the vaccine rollout, and it needs to be improved. Our ARCHOs are not being resourced appropriately for the communications and comms that's required to roll out the vaccinations, nor are the ARCHOs at the table of the public health response. I want government to actually recognise that land councils and community and elder groups are important and vital to the public health response, and they should be at the table of delivering those messages that are vital for our community.
Thanks for that, Dr. Malouf. We'll hand over now to Ms. Kate Fairman for starting the next round. Kate, you're breaking up quite badly for some reason.
Not really.
Yes. Do you want to, that is not working.
Wait.
Kate, I might take the first round, this first 10 minutes, and then
Let's try that. Is that better?
Much better. Go now.
Stupid headphones. Okay. Thanks both of you for appearing today in what is a really, really stressful time for your organisations, and really appreciate you making the time. I just wanted to go to the public health response mainly, and the hospital and healthcare worker capacity in the far west, Western New South Wales local health district, and whether you think it is able to cope with the growing outbreak, particularly with patients, Aboriginal patients who are COVID positive. I might go to you first, Dr. Malouf.
Look, I think particularly in rural or remote communities, we know that the public health infrastructure is very limited, and we know that there are workforce issues out there, and particularly for our Aboriginal community-controlled health services. I would like to acknowledge, though, that the work that our frontline workers are doing at the moment are extraordinary, and they should be congratulated for the efforts that they're doing out there at the moment. But again, you know, what we're seeing here is also our workers on the ground, you know, burning out. And so we don't have a workforce that can, you know, provide the relief work that's required to make sure that the burnout doesn't exist within those communities. And so what we'd like to see is that a stronger relationship with our local health districts to ensure that we're able to provide relief work for our Aboriginal community-controlled health services and for those staff so they don't burn out. But in terms of the number of cases, particularly in far west and far west New South Wales, what I'm concerned about is that we don't have the capacity out there. And so if we see more cases that needing to be hospitalised, do we have enough beds in the region to be able to cater for that? If patients have to attend or have to go into ICU, do we have enough ICU beds to be able to cater for that? And so I am concerned that we don't have the capacity out in the Western New South Wales region. And so I think we need to, you know, the government need to think about how they booster those beds, particularly in ICU for hospitalised admissions.
Ms. Spencer, you were shaking your head as well then when Dr. Malouf was talking about the capacity and beds and whether we had enough ICU capacity. Did you want to expand?
Yes, well, we've asked that question in our local LEMC meeting. What happens when someone needs ICU in Walgett? They'll get flown out of Walgett. They can't be looked after in Walgett at all. What happens to their families as well, you know, when they get flown out? I mean, who looks after single mothers' children if the mother gets flown out? At the moment, they're looking after people isolating at home. They're giving them a machine that I haven't seen it, but I believe that it's one of those ones that tests your blood oxygen levels and your temperature. And then they call on them maybe twice a day. They ring them, health people, and then police might check that they're at home once a day or something. They've got to wave out the window or something like that. You know, the support for people that are isolating at home, I think, can be improved enormously. And then, yes, extremely worried about what happens when, you know, staff within the hospital become close contacts and have to be stood down, and then reinforcements are brought in, and where do they come from, and then what happens if they get stood down, and what happens to the other health issues that we have in this community while they're all looking and responding to COVID. It's a disaster. It's a disaster. And I think that even the hospitals in the district are barely coping. You know, Dubbo, sounds like they've got real issues now, Dubbo-based hospital, and they should be definitely looked into more carefully, please.
Sorry, Wendy.
Yeah.
A case is being flown to Adelaide as well. Are you aware?
Not aware of that from Walgett. No, they talk about flying them first to Orange. There's in 2020 they were telling us the order that they worked it out at, and you know there is a plan apparently. for different stages of this that they've worked through.
Dr. Malouf, is there any? I have seen calls for it in various circles that going to somewhere like Adelaide, if they were able to take some of the patients from the far west, of course, is much closer than some of the other hospitals. Is that being considered, or is that being done?
Not to my knowledge, but it'd be interesting how they would buy through the border restrictions that are in play between South Australia and New South Wales.
You'd think with Broken Hill and Wilcannia and stuff that it might make sense.
Yes, I think it would make sense. I just wanted to go for you to expand. Actually, firstly, Ms. Spencer, if you wanted to just expand on the support, you said more support was needed for people who are in isolation at home or with COVID at home. What does that support look like?
Well, I think that it looks like social work positions within ACCHOs, actually, and they're left to fend for themselves. We're helping our staff just today, before I got onto this call, I was helping them work out how to put together a sheet of information about the food items that is available that they would normally want to order or, you know, buy at IGA, so that they would be able to order them over the phone, because people aren't used to doing that. They're used to having that visual, you know, looking at the food they order, and now they can't. And that's really difficult. And so just being able to ring up, make a phone call and order your groceries needs support. There needs to be a bit of care and sort of well-being support. The New South Wales health staff are the same people that are personing the swabbing testing and the various other activities. They're the same ones that are checking on these people, like they're really overworked. And yeah, I just think that there needs to be emergency support, social work positions, or Aboriginal health workers specially trained in those roles in the ACCHOs.
Thank you. Dr. Malouf, I wanted to continue also something that you have said all throughout the giving your evidence about the relationship between ACCHOs and the LHD, and you're saying that one of the things that's really needed is stronger relationships with the LHD. So what is the communication or connection at the moment, if you like, and is it different to what there was, say, 2 years ago? So how often are you communicating with the LHD? What are the formal lines of you being able to say, this is what we need and give it to us now kind of thing? Could you just explain to the committee a little bit more about how that works and how it could be improved?
Yeah, look, I think at the beginning of the pandemic, 18 months ago, we saw strong communication channels between our Aboriginal community controlled health sector and the LHD. And that was just due to the fact that, you know, they were preparing and planning, and, you know, that obviously steamed them well in obviously the relative, with less cases in New South Wales. But I think what's happened in this particular current epidemic is that you're dealing with crisis in a chaotic environment. And so what's happening in Western New South Wales is that you've got people in the LHD that are managing, they believe that they're managing the COVID crisis out there and that they don't need any other partners in the space. We actually don't have Aboriginal community controlled health services at the table of the public health response, nor sitting at the table around the operations that's required to contain and support the increased infection rates, which is disappointing. What we want to see is now we want to see the LHD and the Aboriginal Community Controlled Health Services, the two CEOs sitting around the table and working together, and also working together with other organisations as well, such as the CEO of the land councils there as well. Because when we talk about working in Aboriginal health, we're talking about a holistic view, and so we can't just focus on the virus. The virus, mutates based on environmental factors. And so it's important that you've got those other parties that are critical to the public health response at the table. But what we're seeing, particularly in Western New South Wales, that it's very government-centric. It's very heavy-footed with you now got the ADF at the table, you've got police at the table. Communities don't want this kind of military type policing with the public health response. What we want is it to be a localized response with community groups, elders, and those key partners to help with the overgrowing infection rates, because communities know their communities, they know the solutions, but they just want to be heard. And that's the problem here with this current outbreak, is that Aboriginal voices are silent, particularly in communities where they're so vital for this particular response.
Thanks, Dr. Malouf. Just for the benefit of Hansard, LHD is Local Health District, LEMC is Local Emergency Management Committee, and WAMS is the Walgett Aboriginal Medical Service. This is so rich in acronyms, dealing with the New South Wales Government. Dr. Malouf, you said before that getting the message out on vaccines in a culturally safe, culturally targeted way is critical. What additional resources do the Aboriginal Medical Services need to do that?
Yeah, look, it all comes down to funding, right? So, what we're doing from a peak body is supporting our local Aboriginal community-controlled health services to work with the local community around language, so to ensure that cultural safe messages are translated in the traditional language within communities, but also at the same time getting them to simplify the important messages around the public health measures, but also the importance of information around the vaccinations. So that's what we're doing. But what we don't have in terms of resourcing is funding to be able to support the ARCHOs. There's a lot of resources and funding that are available for workforce and PPE and those kind of, but in terms of communication, we don't have that. And so, but, again, as a peak body for our 47 Aboriginal community controlled health services, we're doing that bulk of work because we know that it's so important to get the localized messages out there through this time.
Ms. Spencer, what about on the ground in Walgett in terms of getting that message out in a way that's going to be received? I mean, obviously the Army and the police aren't the kind of agencies that are going to be persuading, I would have thought, the Walgett Aboriginal community. So what are the resources needed to make that persuasive case about vaccines and public health?
Well, yes, the AMS has been quietly vaccinating people, forever. And as Dr. Malouf said before, they're very experienced at delivering vaccinations in our workplace, for example. They have an elders health program every week here at Dariwa Elders Group, and they deliver the flu vaccines with no drama, every time they're issued. It just needs to be embedded into their work and resourced appropriately. And we can't really understand why police and the Army are the ones that are resourced to be responding to a public health emergency. And it leads to, potentially really disastrous consequences further down the track, people being issued with huge public health order fines, for example, and, misunderstandings. We're often offering whether our staff, for example, could go and help interpret for the police when they're meeting with community, or whether the ACLOs can have a bigger role with the frontline police in this emergency, but they're really stretched. Sorry, I'm not refocusing.
No, I think you've addressed the question, Wendy. Thank you. One of the first scares for COVID in northwest New South Wales came about through somebody who had been processed through Bathurst Jail and then returned into the community. Dr. Malouf, are there protocols in place with corrective services so that people who are exiting the corrective services and going back into Aboriginal communities are tested, and if they are found COVID positive, have some alternative accommodation, safe accommodation? Has corrective services sat down with you about that?
No, we haven't sat down, nor has the corrective services have sat down with us to explain what their clinical protocols are around our Aboriginal inmates. It's disappointing that the outbreak had started with an individual in Bathurst and then had gone about its community. The issue that we have at the moment is that our Aboriginal community-controlled health services don't have a foot in the door in the corrective centre. If we were to have access to the health facilities, then we know that the continuum of healthcare for our mob in the correction centres would be continued back through to the community-controlled health sector. It's disappointing that we haven't had the conversation about what those infection protocols or infection control protocols are. And what I would like to see is that a more engaged conversation with us about how do we protect our Aboriginal inmates in the system. We actually are unclear about who's doing the vaccination rollout in the correction centres. So that's an important question to find out from our perspective, if they are needing support to roll out vaccinations for Aboriginal inmates, and we were more than happy to step up to the plate to do that. But again, it would be important for the Health Minister as well as the Corrective Service Minister to sit down with us to actually have those meaningful conversations so we can start to protect our community more.
And I assume, Dr. Malouf, you are ready, willing and able to have an urgent meeting with Justice Health to work through those issues, both communication inside the prison system and those safe protocols for community on exit.
Look, we're always happy to sit down with ministers to work through those issues. The thing that we didn't have, particularly with this current epidemic, is that we didn't have a sit down with the health minister around this outbreak, nor have we sat down with the chief health officer to actually work through the public health response, nor have we sat down with them about the opening of New South Wales. What I would like to see is that an urgent meeting be called between the Chief Health Officer and the Minister of Health with our Aboriginal community-controlled health services to discuss these critical issues at this point in time.
Sorry, Dr. Malouf, we are now in coming into mid-September, in the second year of this outbreak, and the Health Minister and the Chief Health Officer have not sat down with the peak Aboriginal medical service body to talk about the COVID response. That hasn't happened.
That hasn't happened at all.
Shocking. It's shocking. There's a partnership agreement, isn't there? So much for that.
Yeah, look, there's a national partnership agreement. There's a jurisdictional plan that outlines the national partnership around closing the gap. But again, what we're seeing from this particular government is that it's very lacking in engagement, and particularly listening to the voices of Aboriginal people in communities. And I urgently request, that we have a meeting with the Minister as well as the Chief Health Officer to work through these critical issues at this point in time.
And right now, as there are plans afoot to loosen the lockdown and open up regional and other parts of New South Wales, I assume that you would urgently want to be talking with the decision makers about what measures you think are needed to keep your communities safe, either in controlling people moving in and out of your communities or otherwise. I assume that's urgent.
Yeah, we want to be able to, convey our community voices to government about the importance of not opening up quickly, because we want to make sure that our Aboriginal communities are fully vaccinated. Between 90 to 100% of our Aboriginal communities fully vaccinated before we reopen. The other thing that we, particularly our Aboriginal community-controlled health sector, as well as our Aboriginal community-controlled organisations, are confused about the public health order, which says that all healthcare workers have to be vaccinated by October. That order didn't include our Aboriginal community-controlled health sector or our community controlled organisations who are frontline workers. And so we're working now with the policy decision makers to change that order to include us in that provision, because we are working with communities, we are caring for mob in this space. Why, neglect us in that particular order? And now why are we having this conversation to change it? So it's very, as I said, we're working in a crisis that's chaotic, that's been led from the top.
Yeah, Dr. Malouf, what's the real practical effect of not being included in that public health order? I mean, your member workforce is out there delivering the vaccines, providing the primary health care, but you're not covered by the public health order about compulsory vaccinations. What's the impact of that?
Well, this level of confusion. So whether our workforce are required to get vaccinated before October, but what our sector have done is actually took it on themselves to actually made it compulsory for their staff to get vaccinated because they know the importance. But what it seems to me that in terms of that public health order is that our Aboriginal community controlled health services are not acknowledged as part of the health system in New South Wales, and that has to change. Is that we are a workforce of about 5,000 people that across New South Wales are working across 47 ARCHOs, and we are a valuable part of the health system in New South Wales, and we need to be acknowledged of that. With the Minister saying that ARCHOs or Aboriginal Community Controlled Health Services are not a New South Wales responsibility, I question that because New South Wales Health provides a small proportion to our Aboriginal Community Controlled Health Services to deliver primary health care in communities. So maybe the Minister needs to think about what he says next time around how Aboriginal Community Controlled Health Services play a part in the system.
Well, I've got to tell you, from the messages we've had from community, from the communications to my officers, and I'm sure other MPs' officers, we all recognise what an essential role Aboriginal controlled health organisations and your members do. I will hand over now to Ms Sharp for a brief round and then to Ms Fairman for the final bit.
Look, thank you very much. And thank you for providing that information that you just have. 5,000 workforce not even considered for prioritisation is, I'm genuinely gobsmacked. I keep thinking I can't get any more surprised, but I do. And thank you for raising it. We will raise it with the government and do that quite urgently, actually. Look, my final question is actually a slightly different issue. It's actually about infringement notices and the way in which the policing is happening in communities. I've had someone raise with me over the weekend that they're concerned that there's a lot of infringements going out, and with the full recognition that people won't be able to pay them, and so they're really heading towards a loss of licence. And I'm just wondering what input or just basically any feedback you have on that on the ground around that, how that is working.
Well, I could give you a little bit of feedback, but we're wanting to get in contact with everyone who has been issued an infringement notice. We've passed one on recently to David because David was saying that he was asking the police minister to do something about them. And, we're supporting people to be getting a legal advice. Legal Aid New South Wales and is helping people with this, but we think that it's a huge burden. We just think it's another byproduct of police being devoted to a public health emergency, which is, really inappropriate. So, that's number one. Yeah, it could be done differently. People do need to stay at home and do the right thing to protect themselves, their family and their community. But I think that if the ACHOs were at the table, they could work out a better way quite easily. The burden it will bring to those individuals who have been fined is just horrific. We're already dealing with a huge burden, multi-millions of dollars of unpaid fines here in Walgett, recently identified by Revenue New South Wales. So they're the the fines that don't get issued by the courts. So, you know, you can add other fine burdens on top of that. So it's a huge exploding issue that we'll be dealing with in years to come.
That's it from me, David.
Yeah, Ms. Kay Fairman.
Thank you. I just wanted to ask just a final question about vaccines, just to check on that period in late July when the New South Wales government decided to send 40,000 vaccines from regional New South Wales to HSC students in Sydney. What impact that had in the far western local health district, and whether that impacted on appointments of Aboriginal communities, whether you saw cancellations there. Dr. Malouf maybe, and also Ms. Spencer if you can.
Yeah, I guess in terms of that particular situation, you know, redirecting supply has now led us into this particular situation in far west and western New South Wales. So, you know, that particular situation could have prevented the further infection rates within that particular region by supplying that to a private school of students. You know, it's just outrageous, right? And, you know, again, it shows this level of vaccine equity that's at play here, is that, you know, we've got, you know, high to mid class, social class individuals that are getting the vaccination more than those vulnerable communities that are from a low socioeconomic background or disadvantage. You know, and that's my concern here as well, is that, you know, we need to make sure that our dose supply, or the supply that we're receiving, is maintained and it's not redirected. Because if it's redirected, then we will have another spike of infection rates, particularly in that region. And so I want to make sure that the New South Wales Government, as well as the Commonwealth, continue with the supply that's been you know, directed to our ARCHOs.
And could I suggest that, you know, you could be requesting, if you need to, under a standing order, I suppose, or a request to be getting correspondence that shows you. I mean, I heard through the LEMC that vaccinations that were on their way to, I think it was Collarabri and a couple of other little communities from here, were redirected. But then, so all of a sudden, they realised, oh no, we need them here pronto. So then another lot were sort of being flown back, or so. Yeah, there was just this sort of knee-jerk responses, which seem really inappropriate, where they were planned to be coming out here late anyway. Should have been much earlier. But yeah, so it would be really interesting to sort of track just how many communities were affected by those decisions.
Thank you.
Dr. Malouf, Ms. Spencer, I'm so sorry, we've run out of time. I think we could have explored the complexity of the issues and the importance of your two organisations at considerable length, and time has beaten us, I'm sorry. I can assure you the issues that have been raised in this session will be put directly in an hour and a half's time to the next session, and we'll be asking for some clear answers about these very reasonable requests that you've been making. So again, thank you.
Just interrupt. Contact tracing is another thing that the ACHOs could be doing much faster. It's very slow and under-resourced. Just wanted to put that in, please.
Yeah, and I've heard that directly from on the ground in Brewarrina, that when the ACHOs got involved in contact tracing, when there were the first concerns in Brewarrina, it was the most effective way of identifying an outbreak.
I'm finding that we have to do that just to try and keep people safe, because it's faster than the way the other system is working. So there's a shadow emergency network that we have to maintain because the New South Wales agencies can't, the way they're set up at the moment, or the way they're resourced, I suppose.
Yeah. Well, thank you again. Thank you for your continuing work in community. Such essential work keeping the community safe. We will now have a break and return again at 2 p.m, where we will have the government agencies and be asking them these questions. Again, I remind. Thanks, Wendy. Thanks, Peter. And again, I remind members, it is probably best to mute your microphone and turn your camera off over the next hour and a half.
Thank you.
Hello, I'm Miss Pearce, Deputy Commissioner Warboys, just checking that you can hear us and see the committee okay.
Yes, thank you.
Thank you. Miss Lil Gordon, could you please just confirm that your audio works? Oh, you just have to unmute. Just in the meantime, good afternoon, Mr. McLaughlin. Could I just check that your audio works okay?
Yes, hi. Good afternoon.
Thank you.
Try now, Ms. Gordon. Could you try again, Ms. Gordon? Can you hear us?
I can't hear anything.
We can hear you, but caught in one of those WebEx loops. While the Secretariat is trying to resolve the technical difficulties with Ms. Gordon, we might commence this afternoon's session of the Public Accountability Committee's oversight of the government's COVID response in New South Wales. Today, we're focusing particularly on the COVID response for Aboriginal communities in northern and northwestern and western New South Wales. This afternoon panel, we have 4 witnesses from the various government departments. Ms. Pearce, thank you for returning. I note that you have already been sworn in at an earlier hearing for this inquiry, so do not need to be sworn in again. But Mr. Scott McLaughlin, could I ask you to give your name, the position which you hold for the purposes of today, and then take either an oath or an affirmation, copies of which should have been provided to you.
Yes, hi, good afternoon. Scott McLaughlin, I'm the Chief Executive of Western New South Wales Local Health District. And today I'll swear an oath. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth. So help me God.
Thanks very much, Mr. McLaughlin. Deputy Commissioner Warboys, if you could do the same, your name, your position, and then take either an oath or an affirmation.
Thank you. Gary Ronald Warboys, Deputy Commissioner of Police, Deputy Sercon. I'll take the oath. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth. So help me God.
Thanks, Deputy Commissioner. Ms. Gordon, I'm going to take that as a good sign. And I note that you'll be leaving us at 3 o'clock. But could you start by giving your name, your position, then take either the oath or affirmation?
Sure. It's Lillian Gordon, Head of Aboriginal Affairs for New South Wales, and I will take an affirmation. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth. Thank you.
Thank you very much. There is a short opportunity, if witnesses wish to avail it, to give a brief opening statement. I'll look to you first, Mr. McLaughlin, if you wish to give a brief opening statement.
No, thank you.
Then to Ms. Pearce and or Deputy Commissioner Warboys.
No, thank you, Mr. Shoebridge.
I'm right to go to Mr. Shoebridge.
Good, then Ms. Gordon.
Yes, please. Thank you. Thank you to the committee for the invitation to appear today. I'm coming to you from Darkinjung country on the Central Coast. I pay my deep respect to elders, both past and present, and pay my respects to all Aboriginal people watching the hearing today and especially those that have been personally impacted by the tragic consequences of COVID-19. I also want to recognise the incredible work of all the frontline workers. I am in awe of the work they do supporting our communities. I also appreciate the impact this is having on them personally and on their loved ones. I am a proud woman from Brewarrina, Niampa country in northwestern New South Wales, and have family across the state. I want to acknowledge the contribution of Aboriginal communities in keeping communities safe and striving to ensure elders and families are protected. Their actions have played a huge role in reducing the spread of COVID-19. In response to the COVID-19 Delta strain, Aboriginal Affairs is working to ensure voices and experiences of Aboriginal communities are as much at the centre of responses to COVID as we can. We know the response to Delta has not gone as well as we may have hoped. It's been particularly hard in recent weeks due to the increase in case numbers in Western and Far Western New South Wales, including places like Wilcannia and large Aboriginal communities. The community and government working together did well last year in keeping COVID out of our communities, but Delta has been a challenge all around the world. Government and community continue to work together in a coordinated effort to meet people's needs and do what is needed to get us through this. I am proud and heartened by the determination and level of cooperation as we work together through this crisis. Our role as Aboriginal Affairs is to identify any blockages or gaps with Aboriginal people and communities and connecting key agencies and services to address those needs where we can, including areas of wraparound support services, support to stay at home where required, access where we can to food and essential services, mental health support services, transport and mobility. Government is working closely with Aboriginal peak bodies and Aboriginal community controlled organisations, including providing funds through grants to ensure they have the resources needed to provide supports. Our role does not duplicate the work and responsibilities of other agencies, including New South Wales Health, New South Wales Police, Resilience New South Wales, Regional New South Wales, Transport New South Wales, and many others, but instead provide the linkages to enable community voices to inform our responses. Thank you.
Thanks very much, Ms. Gordon. I'll pass over now to the opposition to commence this round of questioning. I'm looking to you, Ms. Sharp.
Thank you very much. Before I start, can I just thank all of you for the work that you're doing, particularly Mr. McLaughlin. I know that it's an extremely difficult time in Western New South Wales with a very serious outbreaks. I just wanted to pass on our thanks for the work that you are all doing to try and pull that together. Ms. Pearce, while I've got you here, I just wanted to ask you, based on the answers that we received on notice and just recently about the West Hoxton outbreak, I'm just wanting to understand what actually occurred from the sort of 21st of June in relation to an understanding that there had been an outbreak from the east into southwestern New South Wales, sorry, southwestern Sydney. Are you able to provide any more information to the committee?
Sorry, Ms. Sharp, no, I'm not on that particular issue. Obviously, I'm aware of the issue with West Hoxton and what was occurring at the time, but in terms of the specific details, that's a matter, as you've previously raised, with the Chief Health Officer and the Minister in the previous session.
Ms. Pearce, you are a member of one of the crisis organising group within New South Wales Health in relation to these matters?
Yes, that's right.
So are you able to, I mean, obviously we asked some questions previously, we've now received information from New South Wales Health in relation to the outbreak. Are you able to tell us what advice was provided to government, particularly after the 24th of June, when it became clear that there were more people who had attended the party in West Hoxton prior to sort of the broader lockdown of Greater Sydney?
Not the specifics, no, I'm sorry. I don't have that information before me today. Yes, I'm a member of that committee. However, I don't have the specifics on that. I'd have to take it on notice, although I do note that a response has previously been provided to this committee via questions on notice. So I have nothing further to add at this point.
Well, perhaps if you could take on notice just the issue in relation to, again, we asked the question, what advice was provided to the government, given that the it was clear that it hadn't been contained in the east on the 24th of June, and it wasn't until the 26th of June that Greater Sydney went into lockdown.
Thank you. Taken on notice.
Okay, thank you. I'm not sure. I just want to check whether Ms. Hughes had anything that she wanted to follow up to that.
Thanks. Just one follow-up question, Ms. Pearce. Obviously, I understand you don't have the specifics with you, but were you aware of discussions? The answers provided to us said that New South Wales Health was aware on the 24th of June, and I'm sure you would be able to recall that this was the period prior to the lockdown being announced. Were you aware of discussions within New South Wales Health of the need for a lockdown?
I can't comment any further in regard to that issue. There are various discussions that take place. I believe the question has been responded to previously. It is not generally a matter that I would necessarily be specifically involved in, but the question has to be taken on notice. I do not have any more specifics other than what's previously been provided to this committee.
Okay, I'll pass back to my colleague.
Great, thank you. I think this is a question for you, Ms. Pearce. We've heard some important evidence from people on the ground and from Aboriginal Medical Health Research Council this morning about the lack of coordination and consultation, particularly with the Aboriginal controlled health organisations. There seems to have been a real lag from last year, where I think there was, clearly a view, rightly so, that those organisations have played an incredibly important role in keeping COVID out of Aboriginal communities. We were told this morning that at no point has the Chief Health Officer or someone in New South Wales Health and the Minister sat down with the ARCHOs. Can you tell us why that's the case?
First of all, could I just acknowledge the work of all of the partners involved in the COVID response right across the state, including, very importantly, the ARCHOs and our primary health networks, as well as the districts, the RFDS and more recently the ADF in supporting our efforts. I might, if you don't mind, get Mr McLaughlin to respond to the local efforts in regard to the ARCHOs. I think what is very important, and certainly in discussions with the Commonwealth even as late as last week, it was acknowledged by a range of participants in that conversation that the local efforts that occur district by district are critically important to our response to COVID. On a range of issues, including vaccination, which I'm sure we'll discuss. But if I could hand to Mr McLaughlin to respond to the efforts of the local health district.
If I could I just stop you there? Mr McLaughlin, I will come to you. I just wanted to press you a little bit more on the issue of there just not even having been a meeting at the highest levels in relation to this. Is this because New South Wales primarily sees the ARCHOs as being a federal organisation? Have we got a federal state issue here, or why have they not been specifically at a very high level been brought into the conversation early?
Look, my understanding is that the Centre for Aboriginal Health here at New South Wales Health has been involved in discussions with the ARCHOs and the other Aboriginal groups, which is obviously very important. We have had participants in those conversations. There have also been discussions with the Commonwealth involving both the state and other groups. So there have been conversations to the best of my knowledge, and those conversations should continue.
Ms Pearce, are you able to tell us why the 5,000 strong Aboriginal medical health workforce has not been included in the public health orders in relation to a mandating of vaccines?
I have to take that on notice, I'm afraid.
That would be very good. I mean, there's clearly a problem here. All other health workers have been, are supposed to have been vaccinated, and I presume that means they've obviously gone to the top of the queue in terms of access to vaccine, and yet the Aboriginal health workers across this state have not been included in the public health orders. Would you also be able to tell us whether there is a plan to change that?
On notice, thank you.
Okay.
But I might just add, Ms. Sharp, if you don't mind, just with respect to the vaccination of health workers generally, there is certainly no distinction from my perspective in respect of the vaccination of health workers more broadly across the state. In the early days of the vaccination program, as you'd be aware, there were particular health workers who were in the first priority announced by the Commonwealth, and that was very specifically around ICU and emergency department staff and so on. However, that merged very quickly into all health staff being eligible to be vaccinated, and the merging of those priority groups happened very, very quickly at the commencement. So from our perspective in terms of the vaccination of workers, and that extends to the aged care workforce, New South Wales Health has had its doors open for many, many months to health workers, whether they be our own or from other sectors.
Can I just say that doesn't seem to be the understanding from the art shows at all. But you know, we'll move on from there. Mr. McLaughlin, one of the issues that's we've talked a lot about today and has had, you know, some media coverage and has been raised by local government people as well, is that on the ground the local emergency management committees actually work very well. People are quite people speak very highly of them, but there seems to have been a gap from, you know, where there's, you know, apparently a statewide plan, and I'm talking really about, you know, this has been going for 18 months, and so there's been a plan. Aboriginal organisations and others in those smaller communities with high numbers of Aboriginal people living there have been raising their concerns around the lack of vaccination rates, but more importantly, the issues to do with specific communities. So what we're seeing happening in Wilcannia, and, you know, in Dubbo and other places where there is, you know, people in overcrowded houses, Aboriginal organisations and Aboriginal community members have been raising this issue for quite a long time, that what if COVID came to their community, they would have no ability to isolate. There seems to have been a big gap between what is the state plan and then how that is actually translated community by community. Could you comment in relation to the involvement of health and working through how those state plans seem to have not been translated locally?
Yes, certainly happy to. So across Western New South Wales, we've got a good relationship with our Aboriginal medical services, or the ACCHOs in the region. That entails every month getting together to talk about both COVID and other related issues on a more regular basis. We have weekly engagement down at a community level, and particularly for some of the high Aboriginal population communities, whether it's Gadooga, Angonia, Brewarrina, Walgett, Wilmaringal, Nanama Village outside of Wellington, and an action plan that's come out of discussions with those communities around how we're all going to come together to deal with any COVID outbreak or issues in the community.
And when were those discussions held?
Those discussions started 18 months ago, so back in April 2020. So very early on in the phase one of the outbreak, those engagements with the local Aboriginal leaders in community, Aboriginal medical services, Aboriginal affairs, local council, police, the general practices, other health services in the community, got together to all agree on how we'd respond in a number of different scenarios in particularly those communities, but this has happened right across Western New South Wales. Now, that's the centrepiece of a regular conversation between the Aboriginal medical services and the Director of Aboriginal Health and myself on a fortnightly and monthly basis. It's something that we continually share information around what's the challenges locally, how we're going to respond to those.
Thanks. Well, I'll give you two examples then, one in your area and one in Far West. I mean, it took over a month for motorhomes to be provided into Wilcannia, when clearly the issue of overcrowded housing and how you would be able to isolate people if they were positive has been raised, you know, I presume even 18 months ago. How is it that it's taken over a month to get, this might not be one for you, Mr. McCox, I know this is not your health district, you know, how has it taken over a month for that actually to be on the radar. I mean, people in Wilcannia have been talking about the issues of overcrowded housing for much longer than 18 months in COVID, but it clearly became a very high risk issue. I'm not quite sure who, maybe it's one for you, Ms. Pearce. I just don't understand if these discussions are being held and it's been raised by Aboriginal community. This is not an unknown issue. Why it's took over a month to get homes to allow people to isolate, when for many it's too late. They're already spread it to people in their family.
Ms. Sharp, with respect to the issue you're raising with Wilcannia, as you've noted, the Chief Executive from that area is not present today. However, my understanding is that the first case detection in Wilcannia was the 18th of August and the motorhomes arrived around the 6th of September, so it was not over a month for them to arrive, would be my first point. Would we have liked that to have been sooner? Certainly. The issue was that accommodation had been located for close contacts and positive cases and had been established prior to the arrival of the motorhomes. I just can't remember off the top of my head the name. Was Warrawong out at Wilcannia there, and also at Mount Gips near Broken Hill. Accommodation was sourced quite quickly. However, again, my understanding, my recollection was that in discussion with the local community at Wilcannia, the option of dislocating families away from Wilcannia, particularly if they, were positive cases and the like, was not something that was desirable. And so in our efforts to address that issue, we engaged our colleagues at Health Infrastructure, and one of the solutions was the camper vans, which, as you know, arrived last week. So that was felt to be a good solution. The community was engaged on that by the local health district and the local emergency management structure out there, and had, as I understand it, was felt was the best option, because you'll appreciate in standing up accommodation for either close contacts or indeed for positive cases, the work needs to be done with respect to infection prevention and control, and to make sure the accommodation is suitable and fit for purpose. So that did require a process, and some initial plans around other options were replaced by the camper vans, but certainly it did not take over a month.
Can I give you another example, which I believe is sort of, I think in your neck of the woods, Mr. McLaughlin, is issues around Dubbo. I mean, we've had reports of, obviously a big explosion very quickly there, very difficult to manage, a lot of confusion in the community. Everyone kind of accepts that, but we've had stories of people having nowhere to go when being either designated as a close contact or even I think particularly close contact, and they've done things like slept out the front of their house in their car rather than go in and actually, and worry about their family, and then really not having any other options and ending up going in and then actually getting COVID. I mean, the preparation around accommodation is, I don't for a minute think that it's not a large undertaking, but I'm just trying to wonder, what was the process for people there? If left with an invidious choice, sleep in your car or go into your household and either catch it or spread it to others.
Happy to respond to that. So we have been planning for a number of months around accommodation options in Dubbo and other locations across the region. Now, that's been difficult, securing that, trying to convince accommodation providers to step up to this. But we were very quick to establish a couple of locations in Dubbo where we've got dedicated accommodation, both for COVID positive patients and family members come households. So at Dubbo Zoo, there's 13 rooms with a reasonable number of people able to be accommodated in each of those rooms. We've got another big motel chain that has opened around 50 rooms for the households or staff members, and now a large caravan park with cabins that are dedicated to both COVID positive patients and other people. Now, there's no doubt that there's some large households and complex living environments in Dubbo and across the whole of Western New South Wales. That's been the absolute focus of all of our teams, to help understand and appreciate the situation that people are in. And we've had an Aboriginal health worker dedicated to every COVID patient or person that was confirmed with COVID to wrap support around both them and the household. Now, that's meant an extensive network of food, of other welfare and support services to help people isolate in their homes safely, or help them get into accommodation in other locations. Now, that'll continue. We've got around 500 people today that we're providing that support to that are COVID positive, and over a couple of thousand people in households that every day we're providing clinical care, Aboriginal health workers coordinating all of the other services and supports that they might need. And where necessary, we're certainly helping people to find alternative accommodation. That's certainly been the focus of getting some of the camper vans into Western New South Wales. We now have 20 camper vans available in Bourke, as well as a local motel that's been the focus for the accommodation in Bourke for a number of weeks now, since very early days in the outbreak up there. And another 30 camper vans that are in Dubbo are able to be deployed to any of our communities right across Western New South Wales with very short notice.
Thank you. I just wanted to just go to hospital and ICU beds and escalation. Are you able to take us through how that is being managed in your district?
Yes, certainly, happy to. So out of the total outbreak, we've had 979 cases. In the region, we've currently got around 434 active cases being managed across the region, with 16 patients admitted to hospital, 8 in Dubbo, 2 in Orange, 2 in Bourke, 1 in Narromine and 3 in Bathurst. Now, of those 16, 3 are in ICU, with 2 of those being ventilated. Now, across the whole of our network, we've certainly got capacity in both our acute care beds and our intensive care network to care for all of those patients, and they're being well cared for in the hospitals. In the last 24 hours, we've seen nearly half a dozen patients discharged from our hospitals, and we've seen that on a regular basis, that people will need to come into hospital for a 24 or 48-hour period because they're struggling to breathe, or for other health reasons they need some time in a hospital with the specialist care that we've got to provide that for them. Now, out of all of the 430 odd patients in our community at the moment, that they're all being seen on a daily basis by some of our specialist nurses, our doctors. We've got remote virtual monitoring in place to help them monitor some of their health conditions that are crucial in all of this. And so we've been able to stand up very quickly right across the whole of the region, a COVID care in the community team, specialist clinicians that I think done a fantastic job of helping to provide care for people in their homes and save them having to go to hospital.
I think that's my time for now. Thank you very much.
I'll pass over to Ms. Kate Fairman.
Thank you, Chair, and thank you all for appearing today. I too just want to acknowledge that you are all doing incredibly good, useful work, and thank you so much for appearing today for 2 hours in what I understand is a hugely stressful time for you all. I just wanted to go to you, Mr. McLaughlin, if I can, if you heard some of the evidence this morning, particularly by Dr. Peter Malouf from the Aboriginal Medical Services. He did say that he believes there should be a stronger relationship, his words, a stronger relationship with the LHD, mentioned the fact that the ADF and the police were around the table and the Aboriginal Medical Service wasn't, in terms of making key decisions. What's your response to that evidence today?
Thanks, Mr. Chairman. I think that was in relation to the vaccination program. We certainly recognise there's always opportunities to improve the coordination of that. We've got a daily engagement with the primary health network that supports all of the GPs, the Aboriginal medical services, pharmacies and the respiratory clinics in the region to coordinate with our own vaccination hubs across the region and mobile teams that go out to smaller communities, and with the Australian Defence Force and AUSMAT resources that are in the region that have been doing a fantastic job. Now, the intent of that additional support was always to support the local primary care vaccination providers, and that's, I think, been well regarded in a lot of the communities where there wasn't the capacity to vaccinate 70, 80 and 100% of the population in a fast period of time. The ADF resources have now seen over 30,000 doses of vaccine given across Western New South Wales. They've been to nearly every community right across the region. Where we have had primary care providers like the Aboriginal Medical Services able to vaccinate at scale, and I'll give an example here of Wellington, where the Aboriginal Medical Service, the local general practice and the health service have all got together and formed a hub to vaccinate for both AstraZeneca and Pfizer, that have done way more than a lot of the ADF resources would have been able to over a sustained period. So working with the Aboriginal Medical Service in Wellington, that's been a fantastic outcome, I've got to say. So it didn't need the ADF to come into Wellington, but where we haven't had the ability with the GPs, Aboriginal Medical Services or respiratory clinics to vaccinate 80% of the population, those are the towns where we have prioritised the ADF resources.
Thank you. And what about in terms of the public health response itself? So that was in terms of vaccination. So what relationship, communication, if you like, occurs between the ACCHOs, the Aboriginal Community Controlled Health Organisations, and your LHD?
Sure. So as I was talking before, so the Aboriginal Medical Services and the local health districts meet on a monthly basis to understand that the current outbreak, the issues facing our region, the response that needs to be coordinated. On a more regular basis, a lot of the Aboriginal Medical Services sit around the table at the local emergency management committees, and that's our coordination point within communities to understand who plays what role, how we respond in a range of different scenarios. And in all of those action plans that I talked about before, the Aboriginal Medical Services have been central to understanding how we coordinate health response in those communities. Now, those action plans that have been in place now for 18 months, just in Brewarrina last week, the Chief Executive of the AMS, the Lands Council, the Aboriginal Affairs and other organisations have rehearsed and gone through that action plan on a weekly basis, that they're very confident if they have outbreaks and issues locally of how they respond. And I think that's been a part of the success in Brewarrina, which Lil Gordon knows very well as her home country. So I would say there's definitely been a level of coordination. There's always ways that we can improve it, no doubt.
Thank you. Can I ask about I know there was questions before about the preparation in terms of this outbreak, particularly in relation to housing. And I just wanted to go back to, I think you might be aware by now, because it has been in the media, of the letter that Marima Health Organisation wrote to the Federal Minister, warning that Wilcannia was at risk of overcrowded, they had overcrowded, poorly maintained housing. They were at risk of an outbreak. This was in March 2020. And the Chief Executive, Bob Davis, said in that letter that urgent and drastic action is needed now, especially in setting up fully functioning isolation quarantine facilities and organising services to enable people to properly isolate at home. Were you made aware of that letter at the time?
No, I'm sorry, I'm not responsible for Wilcannia or Marima countries, so no, I can't comment on that.
Right. Were you made aware by organisations that overcrowded housing and, you know, particularly poor housing in various Aboriginal communities was going to lead to a situation like this if there was an outbreak? So back at the very beginning of this pandemic in March, was the LHD looking at housing in particular and developing plans to try and improve housing in Aboriginal communities?
So it's always been a consideration of ours that there's been a Housing for Health program for some years that's supported to upgrade existing housing and develop new housing. Through all of our planning for COVID, it's certainly been one of our real considerations. We've definitely taken the steps to find alternative short-term accommodation for people with COVID, and that's evidenced right across the whole of the region where we've had that need.
Ms. Gordon, what role did the Department of Aboriginal Affairs have in all of this at the beginning of the pandemic, particularly, and I'm thinking around March 2020, when we know that Aboriginal organisations were trying to raise the alarm, if you like, around the real potential for COVID to rip through their communities?
Sure. So our role has always been to work closely with our Aboriginal communities and certainly with our New South Wales Government partners to be able to bring the voices of Aboriginal community forward with our government partners to then reach some solutions and initiatives that were needed to be addressed. So what we did do in March 2020 was stand up two particular groups. One was our Aboriginal Communities Leadership Group, so that we could hear directly from our Aboriginal community leaders, and they were our CAPO organisation, so the Coalition of Aboriginal Peak Organisations, which includes the AHNMRC, so the Aboriginal Health and Medical Research Centre, Newswalk, so the New South Wales Aboriginal Land Council, Aboriginal Education Consultative Group, the First Peoples Disability Network, the Aboriginal Legal Service, Link Up, and a range of other areas, and also for NCARA, so the New South Wales Coalition of Aboriginal Regional Alliances, so a number of the local decision-making alliances that were in play at that time to hear from them. And then on the other side of that, we stood up a New South Wales Government response group so that we could hear from our communities on the ground and then work with our government partners, and then eventually things would come together from that place. So things like a food initiative came together with Resilience New South Wales, with Newswalk partnering and Aboriginal Affairs partnering on a food program with Food Bank, which allowed us to get food out to our communities at that particular time. So they're the kind of things that occurred. That group now is combined. It is the Aboriginal Communities Response Group, so government and community working together. We slowed that down, obviously, as COVID slowed down, and then we've beefed it back up. So we have that on a weekly meeting. We also have an Aboriginal Communities Roundtable where it is just the Aboriginal community groups that come together as part of that. So that's been our role. It's a coordinating role in some sense, but we identify any blockages or gaps really that impact on Aboriginal people and communities, and then we work with key agencies as well as Aboriginal community controlled organisations to be able to close those wherever we can in the process.
Thank you, Ms. Gordon. So in that process, did that group identify the urgent need to get better and more housing in Aboriginal communities, which should have happened obviously before this pandemic, but as a result of this pandemic and the huge risk posed to those vulnerable communities? So did you identify that within government somewhere, that housing needed to be urgently fixed?
So look, I mean, I guess obviously, as we've acknowledged previously, we could have done this better in many ways, and certainly as far as accommodation, that's been a long-standing issue for many of our communities, as been raised in this committee and previous times. So we're well aware of that issue overall. At that time, accommodation was talked about, but probably not in the same way that it is now because of the speed of COVID and certainly the way that it has gotten into our community so quickly. And of course, we have big families living in households, and so that's contributed to the spread. So for us, whilst at that time back in March 2020, it was raised, it probably wasn't the thing on the top. A lot of it was around food security in particular, and certainly those mental health support services and making sure we stayed keeping our communities connected at that time. As this has come in, it's become more and more evident of how quickly we've needed to stand up accommodation where that's needed to be as quickly as we possibly can. And look, we've definitely worked alongside Aboriginal Housing Office as well to be able to try and understand how they might be able to assist in this process as part of it.
Thanks, Ms. Fairman. Ms. Gordon, I don't understand how it took until 6 September for there to be additional housing provided in Wilcannia. This is not months in the making. This has been decades in the making. That's what we heard from community witnesses earlier. It's notorious, the overcrowding in Aboriginal housing in Wilcannia. How on earth did it take until 6 September for there to be the modest additional amount of motorised housing provided to Wilcannia?
And look, again, I think I've probably answered that question in terms of housing has been a long-term issue for our Aboriginal communities, and it's certainly playing a major role now in our national agreement for Close the Gap and initiatives that will be focused more steadily and readily on accommodation issues across the state for our Aboriginal community. So from my perspective, sure, it probably took longer than it needed to. But the speed of COVID, particularly around Delta, I think is one of those elements that brought into play. Look, from our perspective, what we've done is continue to try and work with government and communities to be able to bring those issues to the fold as quick as we possibly could have.
Ms. Gordon, the Aboriginal Medical Service in Wilcannia reached out with a plea of help above you to go to the Federal Minister last year, 18 months ago, pointing out the desperate situation, pointing out the desperate need for housing. Nothing happened. Can you explain why nothing happened?
Look, I have to say I can't recall being aware of that being written directly to Mr. Wyatt at that time from Marama. Marama are an incredible service, and I certainly pay respect to them for the work that they do in their communities. They are incredible in that space, and most certainly we continue to work alongside our communities as much as possible. Like I said, to escalate where we know there's a particular issue, we will continue to escalate that as much as we can to those appropriate New South Wales government agencies.
Well, Ms. Gordon, when did you escalate between March of last year and the outbreak in the middle of August? When did you escalate, and to who, the need for desperate additional housing in Wilcannia?
So look, I couldn't give you an exact date, Mr. Shoebridge, but I can say to you that in working with our Aboriginal Communities Response Group, those issues were brought up at those times, and so we continue to work with New South Wales government partners, and particularly even through the emergency management structure, to be able to bring a meeting together to keep talking about that and then working through what the actual thing could happen as far as getting accommodation up. And there was a meeting with community that was called to understand how we could respond to that in a way that was for them appropriate.
Ms. Gordon, if I was a member of the Wilcannia Aboriginal community and I had heard there'd been escalations and meetings and whatever other additional detail you referred to in your answer, and not a single additional housing unit provided, how do you think Aboriginal community members in Wilcannia will respond to the answer you just gave? Talk, meetings, apparently, but not a single additional housing unit provided. How do you think the community will respond to that?
Well, as a member of Aboriginal communities and absolutely connected to my mobs, of course, it would be disappointing for them. I think, we'd be silly not to say that. So I get their disappointment, and I understand that from their points of view. I think that from that perspective, we have put into place as quickly as we can those things, and working early on with the Aboriginal Housing Office to understand what we could shift fairly quickly, understanding housing units can't be put up overnight as part of that process either.
Who's paying for the motorhomes?
That question, I'm sorry, I don't know the answer to that one.
How long will the motorhomes remain?
Again, that's a question that I'm unfamiliar with in terms of the answer. I'm happy for anyone else to take that on board.
Ms. Gordon, these are the key questions. Ms. Gordon, these are key questions that came
I'm happy to answer that, Mr. Shoebridge. Mr. Shoebridge, Susan Pearce speaking. I'm happy to respond to that. New South Wales Health will be covering the cost of the camper vans in Wilcannia, and they will stay there for as long as is necessary while we work through the outbreak in Wilcannia.
Well, Ms. Pearce, given the housing crisis in Wilcannia, the provision of the motorhomes needs to be indefinite. That's the call we got from Wilcannia in the session earlier today. Will you give that commitment now that they will remain there indefinitely until the housing crisis is addressed in Wilcannia?
I'll take that on notice, Mr. Shoebridge, but as I've said, the need for the motorhomes and for however long they're required in terms of managing the COVID situation, I can absolutely guarantee. As to what happens after that, I will take that on notice.
So it's the position, as you understand it at the moment, that once the critical crisis in COVID moves on, people will be sent back into overcrowded accommodation in Wilcannia.
That is not what I'm saying, Mr. Shoebridge. What I'm saying is you'll appreciate that the New South Wales Health Department has taken steps to get the motorhomes into place. The work that then is required with various other agencies will ensue, and what happens after that is subject to further discussion. We have not had those discussions as yet, therefore I cannot give you a definite answer, but we are there to support that community to get through this period.
Ms. Pearce, while I have you, you were asked some questions earlier by Ms. Sharp about the West Hoxton super spreader party. Do you recall those questions?
Yes, I do.
The Premier has said that she responded within hours of the request from New South Wales Health for a lockdown. Is that your understanding of the circumstances? And when did New South Wales Health advise the Premier that there should be a lockdown of Greater Sydney?
Again, Mr. Shoebridge, I'm not able to respond to that categorically. I don't have that information before me, and my role, to be clear, is to operationalise decisions that are made. I'm not the Chief Health Officer and I'm not responsible for making those recommendations. Consequently, I do not have the specific detail on that before me today.
Will you take it on notice, Ms. Pearce?
I've already taken it on notice, Mr. Shoebridge.
Could you take on notice when either the Health Minister and or the Premier were first advised about the concerns arising from the West Hoxton super spreader party event?
Again, it's not for me to speak for others. I believe the questions have previously been put and a question on notice responded to, but we will take on notice the issues that are being raised today. I cannot respond any further to them.
Including that question, Ms. Pearce?
That's right.
Thank you. Mr. McLaughlin, what is the current vaccination rate of Aboriginal people in the Western New South Wales Local Health District by single dose and double dose?
Certainly. So we've seen a significant increase in the last month in vaccination rates right across the whole of the region through both the Commonwealth-led primary care services and the state-led programs. So Aboriginal vaccination rates for first dose is now 56%. Now that's a jump from 17% only a month ago. The second dose rate is now 38%, a jump from only 14% a month ago. Now it's important to know that the second dose vaccination rate for Aboriginal people is the same as for non-Aboriginal people across Western New South Wales. So I think you can see there that there's been a significant focus in trying to help fast-track vaccination right across the whole of the region, but with a particular focus on our dedicated Aboriginal communities. A lot of supports in place for the Aboriginal medical services, the GPs, RFDS have been coming into a lot of our smaller remote communities vaccinating with a lot of success in the last couple of months.
Mr. McLaughlin, what had gone so horribly wrong that the vaccination rate, the first jab vaccination rate in your local health district for Aboriginal people was the woefully unacceptable 17% a month ago? What had gone so horribly wrong?
Mr. Shippage, I think you'll see it was the same across the whole of the country. It was a real hesitation in getting vaccinated from Aboriginal community. There's been a lot of information circulated on social media and fear
Mr.
campaigns.
McLaughlin, you're not blaming the Aboriginal community for this, are you? You're not seriously blaming the Aboriginal community for this, are you?
Not for a second. No, we've been trying to do everything we can to help everyone get vaccinated, but particularly in our region, some of the most vulnerable communities. We've been out vaccinating across Western New South Wales since the 22nd of March. We had mobile vaccination teams going out to a lot of our smaller rural and remote communities since back then. We've had a lot of programs in our district supporting Aboriginal communities to get vaccinated. We've now delivered over 80,000 doses through the local health district and ADF clinics, and that's been working really closely with Aboriginal medical services, engaging in communities, trying to help give accurate and relevant information to dispel some of the myths that have been created on social media.
We'll come back to this, Mr. McLaughlin. I'll hand over to the opposition now.
Thank you. I'd like to come back to the state plan. People have referred to there being a sort of a state, and I'm not quite sure, Ms. Pearce, you might be able to tell what it's actually called. The state plan that, was then, in preparation for what was happening with COVID. Can you tell me what the status of that, or whether you, and I appreciate you might not be able to give it to us today, but whether you would be able to give it to us basically on notice. So basically the state plan as at 30 June this year.
Ms. Shupp, if you could help me just to be a little clear about what specific plan you're looking for.
Yeah, okay. So what we're talking about is the state emergency plans. What we're told is that there was a statewide, we've been told by numerous people that there's, and I think that, the Minister and others have referred to there being a state plan. The idea was that it's then translated down to local emergency management committees so that they could adapt it. I'm wanting to know what the statewide emergency management plan was, particularly in relation to Aboriginal communities as at 30 of June this year.
So look, we have a range. I might ask my colleague Mr. Warboys to respond to this, but we have a range of plans at a state level with respect to COVID response. So obviously, there's a pandemic plan that's an overarching plan. There are then a variety of other plans that are in place, for example, around vaccination, etc., etc. But in terms of local emergency management and broader emergency management plans, I'll have to defer to my colleague, Mr. Warboys.
Yeah, good afternoon. Thanks, Susan. There was certainly a pandemic plan that was able to be put into place right at the very start of this pandemic. Unfortunately, when we go back and have a look at it now, Ms. Sharp, that it was only 2 pages, I think, and probably a little inadequate to deal with this once in a 100-year pandemic and where we've certainly ended up. But from an emergency management perspective, there are local emergency management arrangements, there are regional emergency management arrangements that sit across the top of that, and there are state emergency management arrangements that sit across the top of that. Right throughout the pandemic, each of those groups of people have gone about assisting and supporting New South Wales Health at each of those levels. The actual emergency management arrangements become active when each of those areas stand up and are required to be stood up. They have a LEACON, a REACON and a CEACON at state level that sit across the top of combat agencies in various functional areas. I think what's important for this discussion is that, and I think Mr. McLaughlin alluded to it earlier, around community action plans for Aboriginal communities that was sought at a local level around about that first or second week in April, and those plans were very much shaped up around local consultation, around how each local community might deal with a pandemic and various scenarios. Those plans were uploaded to Service New South Wales, and in fact, I think have been a really good point of consideration for not just consultation and a pretty much across the board team type approach to it, but certainly shaped what might be to come, albeit, you know, in hindsight, I would look back now and say that what Delta has thrown up at us in the last weeks and months, particularly in regional, rural and remote New South Wales, has been a very challenging and complex environment, Ms. Sharp.
No, thank you. That's actually been very helpful. Would you be able to provide the committee with the statewide plan, the two-pager that you said exists?
Yeah, certainly. I will do that for you.
And would you then be able to? I mean, obviously, the key thing is, as I said, people have been actually very complimentary, particularly of the work of police and others with local government on those local emergency management committees. They're obviously extremely important, and you know, it's good to hear that people like it. The concern has been just that, you know, from a statewide plan, that it's not then really, you're not using the benefit of the wisdom of those people on the ground who understand their communities intimately. I'm wondering whether you'd be able to provide us. I don't want you to dig out a lot of stuff, but even the local plans for, say, you know, Wilcannia, Dubbo, and Broken Hill.
Yeah, I'll take that on notice. I can certainly provide that, but just some additional information, even in relation to Western Health District and Far Western Health District, for more than a month now. We have been, it might be just on a month, we've been meeting regularly in the early parts for an hour each morning, discussing those issues that confront Western and Far Western, and various people around the table, including Ms Pearce and SHEOC and the CEOC and the REOC out at... Could you please just for Hansard's sake what they actually stand for? My apologies. So CEOC and REOC, I think I can guess what that acronym is, but if you could just tell us what it is, that'd be great. Yeah, so the CEOC is the State Emergency Operations Centre, the REOC is the regional, and the LEOC is the local, and then of course Health also have their operations centres for state health and also public health. So thank you. So that discussion each and every morning has been shaping strongly the way forward and the issues and I guess the considerations that need to be made to support the local health districts. And I think it's been quite successful. I think that, as you said, there's certainly a lot of work and a lot of horsepower at the local level that can get tremendous results for local communities. And I've got to say that sometimes those people just need to be enabled rather than directed and supported. And I've been very happy with some of that work that in particular at Wilcannia, even though I guess in hindsight we could look back and would have loved to have done things quicker. I think where the community is at right at this minute over the last couple of weeks, I think we've provided a good deal of confidence there in terms of support to that community.
Thank you. I mean, one of the issues that was raised this morning, which I thought was a good point, was again, you know, where the local emergency management committees are working well, which it seems to be in a lot of places. There are some places where, for example, the local Aboriginal community don't necessarily have a seat at the table. Is that something that you could take on board in terms of trying to address?
Certainly, Ms Sharp, there is no barrier in terms of the consultation that can be brought into those communities, but we must also, in some ways, respect that the arrangements are out of the State Emergency Rescue and Management Act, and it's really important that, I guess, those committees become a focus of decision-making based on community consultation. So the consultation, in my view, there is no barrier to that happening outside of that committee. But to take your point, the Walgett LEMC, which is under Trent Swinton as the liaison, has Miss Katrina Ward, the acting CEO of Walgett Aboriginal Medical Service, Gary Trindle, a good friend of mine, Walgett Aboriginal Community Working Party, Miss Milgate from the Lands Council, Mr. Orworth from Aboriginal Affairs and Ms. Spencer from the Darwa Elders Group, and they have a cap in place. So that's probably one of the really good examples but certainly to your point, I think there's always opportunities to improve. There's always opportunities to share best practice with other LEMCs and REMCs, and I'll certainly take that up and again push that out to those chairs of those committees.
Thank you. Mr. Warboys, if you'd be able to, I mean, I don't expect you to be able to provide this to me today, but if you could take on notice to me, I'm interested in the way in which the number of personal infringement notices and fines have been allocated across the sort of western and northwestern New South Wales. Are you able to provide that to the committee on notice?
I certainly can provide that. I could very much say that some of the data that I asked for or inquired about in terms of some of those areas of consideration certainly showed that the issuing of notices, in particular in that Brewarrina, for instance, since the stay-at-home orders, I have it here in front of me now, ma'am, since the stay-at-home orders took place, which were nearly 3 weeks ago now, 63 offences or infringement notices at Brewarrina and 35 of those at Wilcannia to date. And of course, many more opportunities where police have engaged with local people and chosen not to take any action. Of course, the issuing of those notices is disappointing, and it's a hardship that people will carry. But I must say, by the same token, there does need to be a penalty or an arrangement for people to shape their behaviour. And of course, when we look at the pandemic and we look at the disastrous consequences, I do feel for those people that perhaps have now got the hardship of those notices. But by the same token, at times it's a little difficult to expect police to continually ask for some sort of compliance or behavioural change and not get it.
Thanks, I was just going to see whether my colleague, Ms. Hughes, had she had some questions before our time runs out. Thank you.
I do. Thanks very much, Michelle. Can I also thank everyone for the important work that they're doing, particularly you, Mr. McLaughlin, right on those front lines at the moment. I wanted to ask first to you, Deputy Commissioner Warboys, just about the monitoring of public transport routes. This is something that's been raised this morning, but has also been raised with me separately about concerns around how COVID will travel into the regions on public transport routes. What monitoring is being undertaken for people who are travelling on public transport?
Yeah, certainly we talk and have spoken about this issue now for well over 12 months. In fact, one of the community action plans for Wilcannia very early on was when we got cut it all away and got down to it, it was the fact that people arrived on the bus from the XPT service from Dubbo. They hopped on the bus and hopped off at Wilcannia, and that was an issue for those local people there. We instituted very quickly an arrangement where police met that bus after the XPT service and asked people who were going to disembark at Wilcannia not to even board. But that's a very localised example. In terms of a much broader answer to your question, we have our police transport command that regularly and often have been in and around Central Station, around the bus exchanges. And of course, I'd confidently say then that police in regional New South Wales, every single one of those police would be well aware of the need to task and go to those places where people are light from those services. Is it 100% foolproof? Absolutely no, it's not. And we've actually seen people move from Sydney to Newcastle on the Central Coast and cause issues. And of course, then we have to also make sure that people who need to travel around the state lawfully can continue to do that. So very large state, very difficult to be on every train and every bus and at every airport. but I can reassure the committee that it has been at the front of policing since the start of the pandemic, and has seen many people turned around and many people issued with infringement notices for their behaviour.
Thanks very much, Deputy Commissioner. Ms Pearce, can I move to you and ask about the access to Adelaide for COVID patients, but also for other patients from the far west? Is there an agreement in place that secured that access?
The transport of patients to South Australia has been long-standing, Ms Hughes. It is certainly something that's been going on for many years, and my understanding is that, yes, there have been formal discussions with South Australia with respect to receiving patients from Broken Hill.
And that remains in place even for patients who are suffering from COVID?
As far as I'm aware, yes.
Okay. So that they would not then be transported to Dubbo, they'd actually be going to Adelaide. Is the plan in place?
Look, in most cases, patients who live in Broken Hill, and I lived in Broken Hill for 10 years, so I know the area well. It's a 5-hour trip to Adelaide versus a 7+ hour trip or more, depending on how quickly you move across there, to Dubbo. And so it's a far more frequented route to Adelaide for people who live in Broken Hill. And certainly, as I said, my understanding is that Adelaide would accept patients. You know, it's not to say from time to time there aren't challenges with the movement of patients outside of the COVID environment even. But my understanding is that they have confirmed that they would accept it. In fact, we have transferred a patient to Adelaide during this period from Broken Hill.
So I wanted to ask specifically, because we're hearing anecdotally that patients will have access for emergency treatment, but that follow-up procedures can be difficult. So it's only when it's absolutely required, but this can have flow-on health effects. What are you putting in place to ensure that this access actually remains in place?
Look, as I mentioned, the access has always been in place. There is, from time to time, with challenges with respect to, you know, bed availability and the like, it can be an issue, and every now and then a patient may be moved eastward from Broken Hill. I suspect that we would find that is the minority of people who would come east rather than going to Adelaide. In any circumstance where you move a patient to a centre that has a higher level of healthcare available, there's always the need to have eyes on how that patient is cared for and followed up into the future. So those things are obviously very important. And in any health system, you do not move people unless you have to. It's not something that anyone takes lightly in terms of that movement, because it is very dislocating for families and quite stressful. So people who need to be moved get moved when that's necessary. The follow-up care these days, obviously, telehealth plays a role in assisting with any follow-up services that may be required. And of course, Broken Hill has and has traditionally had a significant amount of medical specialists who come from South Australia routinely into Broken Hill. You'd have to give me more specifics as to what you're talking about in order for me to respond more precisely, Ms Hughes.
Yeah, and look, obviously I don't want to give away specific circumstances that have been raised with me, but these are the concerns that have been raised. Are you having any issues with the access of those specialists from South Australia coming into Broken Hill to provide those services at the moment?
Look, I'd have to take that on notice in terms of the specifics. Obviously, from time to time, as you would all be aware, with various issues associated with borders, there have been some challenges with movements at times in terms of health staff. We've worked hard with our state counterparts to ensure that people who need to come, particularly to rural communities, are able to do so. and we would continue to work on that. We've also been involved from time to time with discussions with our state counterparts in Victoria and also South Australia to make sure that access is possible. But if there are specific issues, please do let us know, because obviously it's our job to make sure we address those as promptly as we can in the interests of people who live in those communities.
I think my time may be drawing to a close, but I might just ask one final question about food rations that are provided to, particularly to our remote Aboriginal communities. I had one sent to me today, which had a pack of flour, sugar, some long life milk, some rice, and pasta sauce. There didn't seem to be any fresh food that's in that basket. Is that standard, or is fresh food and fresh fruit and vegetables being provided as part of these food rationing hampers?
I might pass to Mr. McLaughlin to respond to that on the local level, Ms. Hughes, if that's okay.
Of course.
Thanks, Ms. Hughes. So yes, there is fresh fruit, vegetable, meat and other products provided on a daily basis into homes where there's someone with COVID or a household needing to isolate. That's, I think, been one of the real successes in the last month across Dubbo and the whole of Western New South Wales, is making sure that people can isolate and have good fresh fruit and veg. We actually received some requests from Aboriginal families that were wanting to do some traditional cooking and some bickies, breads and other things that needed the flour and everything else that you were just describing. So that was a response to a specific request from some of the Aboriginal community and families.
Okay, I understand.
We have going to move across to Ms. Kate Fairman.
Oh, okay.
There is further round at the end. We'll come back to you.
Thanks very much.
Thank you, Chair. I just wanted to go to the situation in Angonia. Mr. McLaughlin, how many cases are there currently?
Sure. So we currently have 21 cases in Angonia. The first case was identified back on the 27th of last month. Sorry, the 28th of last month. We've provided a lot of support into Angonia to both provide the clinical and welfare and other supports for the whole of the community, but also particularly the patients that have got COVID and the community and the family members that are isolating with them. In the last week, we've undertaken a pretty complex assessment for everyone in the community, the vast majority of the community, that has included their health issues, the living conditions, any mental health or other social concerns that they might have, to make sure that we can wrap support around those households and individuals. Now, we've got a full-time 7-day-a-week Aboriginal health worker and clinical teams that are coming into Angonia to provide the clinical and other cultural care for those households.
Okay, are you aware of the article in The Guardian actually on Friday, just this Friday, with descriptions by healthcare workers on the front line saying it's not really clear who's in charge, and they're describing the public health response there as chaotic. They're calling for more help from the New South Wales Government to coordinate this crisis. Are you aware of some of the criticisms coming from healthcare workers on the front line?
Yeah, I've seen the article. I've got to say that there's a different reality of the level of support that's being provided into Angonia by both the local health district, the Aboriginal Medical Service, the Royal Flying Doctors Service, Oka Health and the general practice have been all very active in the community. We've got a lot of support from police and ADF, from other community groups that are providing food into households and other supports into the community.
So what are the healthcare workers that are staged there permanently at the moment during this crisis?
Sure. So we've got a full-time Aboriginal health worker that's 7 days a week. It's more than one person obviously, that'll be committed to providing some of the coordination and support for people with COVID and the households. A clinical team that'll come in with specialist nurses and other clinicians that'll come in to provide support. I know the Aboriginal Medical Service plays a significant role in this as well. So, yeah, I know there's always a need to an opportunity to coordinate things better. There's no doubt. From the Commonwealth Services, I think there's.
Sure. So with the Aboriginal healthcare worker, what do you know? So I assume there's a couple of those workers then sharing that 7-day shift. Is that what you're saying, that live in Angonia?
Oh, yes, they do. Either live in or travel into Angonia for the dedicated time there.
So what happens, what about with emergency situations and transport for COVID patients that need to get additional health support or go to hospital? What happens with the ambulances or patient transport?
Sure. So we've got a number of transport options for the community, both RFDS and New South Wales Ambulance are ready on tap and available at a minute's notice to provide acute care and support if we do need to transport someone out. Last week we found an additional transport vehicle to be dedicated into Bourke to support people getting to and from Bourke and Angonia, where they're either being provided with accommodation and need to get home, or need to come to Bourke for other reasons, and so that's an additional community transport service. Likewise, we've also got our patient transport vehicles that will help people not in critical care conditions, but that there's a lot of additional transport available to try and improve both the outreach to Angonia and for people moving between Angonia and Bourke.
Because at the moment, so Angonia obviously has no hospital. They're in terms of facilities there. What is the basic health facility that is in the Angonia? And is it, what's the population again? Sorry, Mr. McLaughlin, it's 137.
Sure. So Angonia's a community of around 150 people. Changes from time to time. The vast majority of community are Aboriginal. We do have a community health facility in the community that's got on a number of days a week a clinician and Aboriginal health workers that'll visit to provide services to the community, whether that's chronic disease services, early childhood, or other supports for the community. We've been really successfully running a couple of programs, one that's to help community cook fresh fruit and veg and healthy meals called Murrungdali. And so there's been a lot of these programs and community health services provided both out of the community health centre and throughout the community.
So witnesses earlier today did express concern about Dubbo Hospital's capacity to continue taking COVID patients. Is there capacity limits? I mean, obviously there are capacity limits. Is Dubbo Hospital reaching that capacity? What does that look like going forward?
Sure. So we've developed a lot of capacity to increase Dubbo Hospital and a number of our other hospitals' capacity to care for COVID patients right across the region. Dubbo currently has 4 COVID ICU beds operating with 4 patients in those. Obviously, we've got quite a few acute care beds that are dedicated to COVID patients, and that can be scaled up further if there is increases in COVID patients needing hospitalisation.
Okay, how many ventilators do you have in the Western LHD at the moment?
Sure, so we've got the ability to scale up significantly the number of ventilators. We've currently got a lot of the equipment and facilities to be able to scale up from currently around 13 dedicated intensive care beds right up to 45. Now, not all of those will be prioritised for COVID-related patients. We'll still need to care for other patients across our hospitals. And so around 35 of those would be able to be dedicated to COVID patients.
Do you need to bring health workers in from other LHDs to be able to staff those ICUs? And I'm obviously talking about ICU trained staff and people who are able to use those ventilators. healthcare workers who can use them?
Yes, we certainly have. We've been helped out by a number of the Sydney local health districts with additional intensive care trained nurses and doctors that have now come into Western New South Wales, not just to Dubbo. We've seen some additional staff go out to Bourke to help care for patients. And we've got the support of the AUSMAT team, the Australian Medical Assistance team, that are also supplying in some critical care or intensive care trained clinicians as well. It's certainly one of the areas we've been working on for some time, recruiting in the right number of staff and identifying when we need them, where we bring staff in to care for patients.
Okay, can I turn to paramedics then in terms of staff? So the front page of the Telegraph today had the news that firefighters may be used to drive ambulances because of a shortage of paramedics at the moment, or the demand. Is that the case in Western LHD? Have you heard that that might be a solution to the shortage of paramedics to cope with this Delta outbreak?
So I'm not responsible for ambulance service, but I know we've been looking across all settings at how we staff services, what the skills are that we'd need, and the right people to do that. So I'd be open to exploring those type of solutions.
You're not responsible for paramedics, but of course that you would be part of the response, that conversation. That would be part of that emergency management plan. So is a shortage of paramedics leading to long wait times for patients? Is it becoming a big issue in Western LHD, which of course we're seeing here in Sydney?
I couldn't comment on the ambulance service and their capacity, sorry.
Okay, I think my time's up.
Thanks, Kate. Mr. McLaughlin, you know that Aboriginal and Torres Strait Islander people have had priority access and been a priority group to have access to the vaccine since at least February of this year. Are you aware of that?
Yes, I am. Yes.
You tell this committee that a month ago, it's around about the 10th, 11th, 12th or so of August, the vaccination rate for Aboriginal people in your local health district was 17%. Is that right, for first dose?
Yes, that's right.
The vaccination rate for the general population of Australia at the time was 44%. Do you accept that something went very badly wrong for that discrepancy, given Aboriginal and Torres Strait Islander people were a priority group?
Mr. Shoebridge, I think there's a lot of things that have contributed to it. The hesitation from a lot of people in our communities has been because of a lot of the misinformation and fear that's been around some of the vaccines. We've been vaccinating across the region for the last 6 months now, going into communities like Bourke, where only 2 months ago we had a vaccine hub set up for a 3-day period, and 50% of those appointments weren't taken up or filled. Now, that was a lot of, going back 2 months ago prior to the current outbreak, that there was a real hesitation to come and get vaccinated in that community. Now, that's drastically changed now, and helpfully, there's now a lot of the community have been vaccinated in Bourke and across Western New South Wales. So I think the current environment has certainly changed that. There's no doubt there's been some hesitation and concerns over the last 6 and 9 months.
Mr. McLaughlin, we heard from the peak body for all Aboriginal medical services that they haven't even had a meeting with the health minister or with the chief health officer. Do you accept that that failure to engage with the peak Aboriginal medical service body in New South Wales would have contributed to the failure to get the message out?
No, we've had very regular conversations with the Aboriginal medical services and the peak bodies around Western New South Wales. I can't comment any more broadly than that, but there's been a strong intent to coordinate the vaccination program, coordinate all of our whole COVID response.
Mr. McLaughlin, were you getting reports about the vaccination rate in your region? Were you getting regular reports up until a month ago?
Yes, I have been. Absolutely.
So what did you do?
We had vaccination programs going right across the whole of the region. But we've now delivered nearly 80,000 doses in Western New South Wales in the last 6 months. We've had mobile teams going out to smaller communities. We've had major vaccination hubs in Dubbo, Orange and Bathurst. We've had a program with the GPs, the Aboriginal Medical Services, the Commonwealth Respiratory Clinics. It's important to know that 2/3 of the vaccinations in Western New South Wales and across the whole of the state have been delivered by the Commonwealth-led services. And so there's been a coordination of effort for a number of months now to try and improve the vaccination rates. It hasn't been for a lack of trying, but there's been, that the vaccination that's come in the last month has really helped us to fast track that.
Mr. McLaughlin, it's no good defence to your organisation that the heavy lifting has been done by Commonwealth-funded organisations. So you did a minority of the minority. Is that what you're telling me? You've done 1/3 of the 17%.
I don't know how you do those figures, but we've had teams on the road for the last 6 months going to every community, vaccinating as many people as we can. So that there's been no lack of effort in that the Commonwealth and the primary care providers absolutely are the main venue for delivering vaccines across Western New South Wales, the whole of the state. Those figures aren't any different to any other part of the state.
Well, Mr. McLaughlin, they're radically different. The vaccination rates in non-Aboriginal communities were radically higher than they were in Aboriginal communities in your local health district. You're not suggesting otherwise, are you?
No, suggests that the Aboriginal vaccination rates in Western New South Wales weren't any different to any of those across the whole of Australia. But we've had every effort to try and improve those. I know the Aboriginal Medical Services and RFGS, the GS, the police and everyone else has been trying to do the same for quite some time.
Mr. McLaughlin, the Aboriginal Medical Service peak body said that they're not funded to provide the communication with communities, to work with communities in a trusted way and provide advice about vaccines. They're not funded by you to do that, are they?
I'm not sure what that means, but the AMSs have been providing
you again if you're uncertain about the question. No, stop, Mr. McLaughlin. Mr. McLaughlin, if you're uncertain about the question, I'll be very clear. Does the local health district provide any funds to Aboriginal community-controlled health organisations to communicate with the community about vaccines and to encourage the uptake of vaccines? If so, how much money and to who?
So the funding for Aboriginal medical services predominantly comes from the Commonwealth Government. The state does supply funding to Aboriginal medical services right across the state and across Western New South Wales. The local health district doesn't step in to directly fund Aboriginal medical services. But on a daily basis, we're talking and working with them about how we can do this. I know in certainly some of our communities, we've done a joint campaign to help improve the communication around vaccination, around how to access it, the evidence and accurate information on that.
Mr. McLaughlin, I'm getting no acceptance of responsibility or acknowledgement of failure from your organisation, from an organisation which is leading a local health district that had 17% vaccination, first dose vaccination rates amongst Aboriginal people a month ago. I'm getting no acknowledgement that things need to change or that there needs to be a fresh approach working with Aboriginal controlled health organisations from you. Is this what I should take away from your evidence today? That you think it's fine and nothing should change?
Far from. Our every waking hour is dedicated to trying to stop COVID in our region, to try and get people vaccinated. We've done a lot of things to help that, but there's always things that we can do better. There's no question. You know, I don't go to sleep every night thinking about the things that we've done. It's always, what do we need to do more? That there's always things that we can do with our Aboriginal communities, with our partners and other organisations to improve this.
Ms. Pearce or Mr. Warboys, on the local emergency management committees in Western and Far Western New South Wales, I know that the membership is determined by local councils, but can you advise on which of those local emergency management committees there's an official representative from an Aboriginal controlled health organisation?
Yeah, thanks, Mr. Shurich. I can make comment. specifically health organisation or Aboriginal representation invited to the meeting?
Well, my first question is Aboriginal controlled health organisation. But if you wanted to give some more detail, Mr. Warburg, you'd be welcome to.
Yeah, thank you. I've just had some notes here in front of me, and I'm happy to share that later if required. But certainly, the one at Wilcannia has Marama Aboriginal Health. The notes in front of me. Broken Hill has Marama. Burke has Maranuka, which is not specifically Aboriginal Health. Walgett has Aboriginal Health. Brewarrina only has Aboriginal Affairs by the look of that, but certainly also then representatives from New South Wales Health. And of course this list, Mr. Shoebridge, I'm not suggesting is exhaustive either, but I can provide the committee some assurance that in more recent times, certainly on the back of the COVID spread from out to Dubbo and out to Western New South Wales, our LEMCs, our liaisons were made very clear, and Ms. Lill-Gordon also followed up with us not that long ago around making those emergency management arrangements quite open to Aboriginal influences around health and community.
Mr. Warburg, what I've heard from many Aboriginal organisations in Western and Far Western New South Wales is that they have been invited in to some meetings, and that indeed the invitations have become, there have been an increased number of invitations in the last month or so, but they're not members of the committee. They're not there when the decision is being made. Their advice can be ignored. Do you accept that that is a problem, Mr. Woolworths? Although it's a step forward, not having those Aboriginal organisations formal members to make the decisions is a problem.
I'd have to go back to the State Emergency and Rescue Management Act and see the exact nuances around how committees can be varied. But certainly I'm not in any way, shape or form, Mr. Shoebridge, denying the fact that each of these committees has a chair. Each of these committees represents an opportunity to assist local communities, not just with their health, but any emergency and disaster. And if there's room to have better and more appropriate representation on that, I'll certainly explore that and take that away, Mr. Shoebridge. It is about local people and local communities at their greatest time of need to make choices and decisions that protect people in terms of health and their safety. So I take note of the point that you raised. I think an extraordinary amount of effort has gone in the last number of months and weeks in this regard, and certainly there may well even be a lesson or lessons to be learnt out of it. But I can say that we all understand that the pandemic in terms of Western and Far Western New South Wales is far from over, and we need to continue to make sure those emergency management committees represent the community and indeed then allow decisions to be made by agencies to make sure that it's the best outcome for those people.
Thanks, Commissioner Warburg, and I look forward to some of that detail on notice, and I will hand over to the opposition.
Thanks very much, Mr. Chair. Ms. Pearce, I wanted to come back to you. There was a significant delay in some of the testing results, particularly at the beginning of the outbreak around the West and Far West. We have heard that there was a difference depending on the testing company. Perhaps you were getting them within 12 hours and the other one was taking perhaps 6 to 7 days. That had significant consequences for the community. Have you made any, have there been any consequences for the companies for those significant delays, or, yeah, I'll just leave it at that. Has there been any consequences?
Look, I think at the commencement of the outbreak in Western New South Wales was a period where there was enormous pressure on testing capacity, as you would be aware, and certainly a lot of effort was put into improving turnaround times for the particular private pathology providers as well as for our own. And I'm pleased to say that that has improved. I don't have the exact numbers with me here today, but there was significant effort made to improve those turnaround times, including data entry at the commencement. In Broken Hill and also in Western New South Wales, and Mr McLaughlin may be able to comment on this further, there were also machines put in place to enable more rapid testing to occur very quickly, and those machines were installed into those regions quite quickly after this outbreak occurred as a consequence of wanting to make sure that we could turn around those tests, particularly for close contacts, as quickly as was possible. I know we had a couple of issues from time to time with weather that delayed some transport, which was an issue. We also had an issue with some close contacts in one of the labs in Dubbo. So a few issues that we had to work through there, but certainly every effort has been made to improve those turnaround times, as I said, including sending machines to the area, as we have done here in Sydney over the period to enable rapid testing to occur. So, Mr McLaughlin, I don't know if you wish to make any further comments about that.
Thanks, Ms. Fitz. So we've installed a number of fast turnaround testing devices in the last month as a result of both some of the localised outbreaks and the regional need to get test results processed faster. Into both Burke and Walgett, we've installed what's called a LIAT device, a device that can turn around a test within 20 to 25 minutes. For someone, both of the Aboriginal medical services in those communities have fast turnaround COVID testing devices. Into Dubbo, we've now installed a number of additional devices, as well as some of the private pathology providers that have got a very fast turnaround in Dubbo, and a logistics network right across the whole of the region to quickly get in test results. So an example I give you is yesterday afternoon we put on an additional transport route with the issues we're experiencing up in Walgett to get the test result, the swabs down to Dubbo with a very quick turnaround that picked up from both Lightning Ridge and Campbell on the way through it. So, but those are the things we're doing to try and improve the testing turnaround times.
I'm sorry to briefly interrupt, Ms. Hughes, but Ms. Gordon, I do know that you said you only had time until 3 and you've been sitting there extremely patiently. If you do need to go, then we would fully understand you came here with that commitment.
Yeah, thank you. Look, if there was no further questions, I'm happy to hop off, but also if I need to stay, that's okay as well.
All right. Well, I'll ask the opposition if they have any questions of you now. But you came with that. You did come and tell us you had until 3, Ms. Hughes.
No, I don't have any further questions, and I think my colleague's indicating that we don't have any further questions for Ms. Gordon if she needs to leave.
All right. Thanks again, Ms. Gordon, for your attendance today.
Thank you.
Ms. Pearce, I might come back to you. I wanted to ask about the contact tracing, and in particular for Western and Far Western New South Wales. Is that still being run centrally through New South Wales Health?
Again, not my specific area of responsibility, Ms. Hughes, but certainly contact tracing is something that is supported centrally here from New South Wales Health, but also in local health districts with local contact tracing teams.
And so we did hear this morning from the Aboriginal medical services that they would have capacity. In fact, they have stepped in to do some local contact tracing themselves because of the delays. Have you pursued any formal agreements, or are you looking at agreements to do that?
I'd have to take that on notice from a New South Wales Health perspective, but Ms. McLaughlin, I don't know if you're aware of any local arrangements there with contact tracing.
Thanks, Patrice. So we've scaled up significantly our public health team and our contact tracing resources to try and get that much quicker and to do it locally within the region. Certainly open to ideas around how we can improve that. We know it's going to be crucial over the next 6 and 12 months to improve. If we can work with the AMSs, then happy to do that.
I'd refer you to the very compelling testimony they provided us this morning, which explained how, because of the delays that they're seeing in the central contact tracing, they've almost got their kind of own shadow contact tracing system up and running. But that will all be on the public record. I wanted to come now to the question of the post-COVID and the recovery for patients. What is being put in place and what support is being put in place now and planning to provide the ongoing health support for those patients who continue to suffer from long COVID? We know that these communities that specifically that we're talking about today already have difficulty accessing medical support and services. What's being done now to ensure that this doesn't continue?
Thanks, Ms. Hussos. So we have started planning for the impacts of long COVID in our rehabilitation programs. Our rehabilitation specialists have been following the international evidence, the impact of COVID and the need for respiratory and cardiac rehabilitation services connected to those. We've certainly got a lot of rehabilitation programs across the region. It will need us refocusing some of those around the needs of COVID, but our specialists have been watching this for quite some months now and started a really active conversation in the last month with the outbreak about us needing to not just care for people in that 14 or 28 days of their active COVID period, but for the potentially years in the future.
And how many of those rehabilitation specialists do you have currently across the Western New South Wales Health District, Mr. McLaughlin?
I couldn't give you an exact number. A number live locally, a number fly in from other parts of the state or the country to support our rehabilitation services. I know we've got some amazing clinicians that live and work in the region.
Perhaps you could take that one on notice for me.
Happy to.
Excellent. Ms. Pearce, how many specialists do you have working across the state on this?
I'd have to take that on notice, Ms. Hussos.
And perhaps you could provide us with a breakdown by local health district as well?
On notice, thank you.
Thanks very much. I was going to pass to my colleague. Yes, sorry, she's ready. Yes, I'll pass to my colleague now.
Thank you. Thank you. I've just got one question, and I suspect you're going to have to take it on notice. For Far West and for Western New South Wales local health districts, would you be able to provide the committee with a list of the number of redundancies that were provided to staff to June this year so basically for the last financial year, and the list of positions that were made redundant?
Yes, you're quite right. We'd have to take that on notice. Thank you.
I'm not quite sure how much longer I've got. I do have one question though. One of the issues that the art shows raised with us this morning was the lack of coordination between Justice Health and their organisations in relation to releasing people out of jail and how they're managing that. Obviously, there's some of the outbreaks have occurred as a result of this. And I'm just wondering what action you have taken or can take in relation to this. We were told that there's not really any protocol. Essentially, people, because Justice Health are responsible for the health within the prison, they pretty much walk out. It seems that there's a very good opportunity to sit down and work something out about that. Just wondering if you can tell us what the situation is.
Yes, look, I think there is an opportunity to improve connections, and that's one of the things we've learnt right the way through COVID, that an unfortunate consequence of this disease turns into some opportunities to improve things into the future. And I do believe post some of the issues that we've experienced in the correction system, there is an opportunity for us to improve coordination upon release. Certainly, we've been working through those issues, and I think it is a very timely opportunity for us to include the ARCHOs and other Aboriginal health organisations in that work.
So, Ms. Pearce, when you say you've been working through that, are you talking about Justice Health, New South Wales Health internally? You haven't... I mean, the ARCHOs basically said to us that they're very keen to actually put in place some clinical protocols around that, but they just have no, sight into that decision making. So has that just been done internally in health?
So what I'm saying is that through this recent period in particular, work has been going on to improve the coordination of the release of people once they're released from prison, noting that obviously once released, and particularly if there are no conditions associated with the person's release, it is very easy for the system to not necessarily have good coordination around that individual. That's an opportunity for us to improve. And we've been working on that. So when I say we, I'm talking about on the New South Wales health side, in particular with corrections, and I agree with you that there's an opportunity to improve the coordination through the ARCHOs in doing so. So happy to take that one on board.
Thank you. I actually don't have any more questions, so I don't know whether Ms. Hughes does.
Sorry, I just wanted to come back to the question. I mean, we did touch on the, or we spoke about this at the beginning, about the initial preparations around housing. Perhaps you could just explain to me, Mr. McLaughlin, you talked about how you've got the Dubbo Zoo and you've got the motel chain that's up and operating. How many of those were actually in place prior to the outbreak? How many of those housing and accommodation arrangements were in place prior to the actual outbreak that started, this most recent outbreak?
Well, we've certainly been having conversations with a lot of the motels and other accommodation providers around the region. I think it's worthwhile acknowledging no one wants to have their motel name attached to being a COVID accommodation facility. So it was near impossible to line up those arrangements prior to the outbreak that we saw, particularly in Dubbo. But very quickly, in the first days of the Dubbo outbreak kicking off, we were able to secure the zoo. It was an offer that came to us from the zoo to utilise those facilities. Likewise, another motel chain, and now the caravan park. So that they weren't in place prior to the outbreak. It was certainly something that we put a lot of effort into in previous months to try and line up those accommodation facilities there.
And Ms. Pearce, perhaps you can provide us on notice for far western New South Wales, how many of those were actually in place prior to the outbreak?
Happy to take on notice in terms of the specifics. However, I would note that, as Mr. McLaughlin's mentioned, all of our local health districts, as part of their planning for COVID outbreaks, have been asked over a period of time and have done so to look at what is within their geographic region by way of hotel or motel facilities, as Mr. McLaughlin's outlined there. So you wouldn't necessarily have something in place, you know, and not be using it. That would not be a good use of public funds in the absence. But having something ready to go and stand up very quickly is really the aim of what the exercise here. So from our perspective, all of our districts have had that. Of course, when the reality of COVID arrives in a community, sometimes, you know, organisations who may have previously been willing to participate get concerned about having positive cases in their facilities and the like, and there is a need to do thorough assessments of their suitability, both from a security perspective, but also from the infection prevention control perspective. I know that in the far west, around Broken Hill, as I said, Mount Gipps had been identified as a potential, as had other areas in Broken Hill itself, and I think Mr. McLaughlin's outlined his area as well.
Thanks, Ms. Pearce. I'll now hand over the questioning to Ms. Fairman.
Thank you, Chair. Mr. McLaughlin, I just want to go back to the situation in Angonia, if I can. Just having a look at the comments by the Health Services Manager for the Burke Aboriginal Health Service, Claire Williams, in that article in The Guardian I was referring to. She was quite critical of the services that have been provided to that community to date, basically saying that there's no doctor, there's no nurse, and worried that if there is exposure to COVID by any of the say the Aboriginal healthcare workers, that really is an issue. She's also called for New South Wales Health to step in. So that seems to be that health experts on the ground are suggesting that New South Wales Health isn't doing enough to deal with the crisis that is unfolding in Angonia.
Well, Mr. Chairman, the Aboriginal Medical Service has certainly been out there in the last week vaccinating. We sent a team out to support them to vaccinate in the last week. We do have, as I outlined before, a 7-day-a-week Aboriginal health worker and clinical teams going out there. They're supporting directly the families or households with someone infected with COVID in them. We're providing a lot of food and other welfare support into those homes. That's been a good outcome with police, the ADF and other organisations. There's always more that I'm sure we could do and more to coordinate. But I know that the Aboriginal Medical Service provides a lot of services into that community as well.
Will you guarantee or commit now to hear from the Burke Aboriginal Health Service as to what more could take place? I mean, she is, calling out via national media, if you like, that New South Wales Health and the Royal Flying Doctor Service needs to step in when it comes to what is required now in Angonia. And I can see on social media as well, there is quite a bit of concern about what is unfolding and the support that's being provided.
Well, certainly. I was out in Burke last week meeting with the Aboriginal Medical Service Chief Executive. We've committed out of that to do a number of things together. There was a meeting planned for this morning that, unfortunately, I think the Aboriginal Medical Service had to cancel out of. It was intended to do exactly this, to better coordinate, look at the resources and try and find ways to work together.
Okay, thank you. And can you guarantee in terms of food delivery, again, I can see on social media just in the space of the last, say, 5 or 10 minutes, people concerned that food deliveries aren't getting in there. And I know that this has potentially been a coordination issue, if you like, but we've got members of the community wanting to send food parcels to elders in Angonia. They say that they have been stopped. They can't go any further than Brewarrina. Is there a reason why they're saying that they're hearing there's been no food delivery in 2 weeks? So possibly it's a question of the way in which the Western Local Health District is communicating what they're doing to the Aboriginal community.
Mr. Chairman, there's been no shortage of food available for the patients and families and households with COVID to make sure that they can be supported in their isolation. The example I think you're referring to was an organisation, Uniting Care, that was providing in food hampers on a regular basis that were asked not to come into the community because they didn't want to have too many people coming into the community. Now there was an arrangement made for the distribution of that food in the community, and not all of that got to the places that was intended to. Certainly nothing to do with the local health district. We've been doing everything possible to supply in food for particularly those households with people with COVID in them. And I know that's extended to a lot of the rest of the community.
So, for example, in Angonia, you can give a commitment today that no household is going short of food at a time when they have to isolate and can't travel to get that food?
Certainly for households with someone with COVID in the household, and that's the commitment that we've been giving, is to provide food into that household to minimise or reduce or stop the need for anyone needing to leave the home for any food, social service or welfare needs.
Can I check with other households as well? Because I understand that Angonia has a pub that has very basic, sells very basic provisions, if you like bread and milk and other things. But to get to a supermarket with a lot of other provisions could be 100 kilometres away. So I would have thought the parcels being delivered by the ADF and the police and what have you are actually parcels to every single household. Are you saying that that's not the case?
I know there's certainly been a big volume of food going into the community. I can't talk for every household in the community. Maybe Mr. Warboys can comment, because I know the police ADF, local groups have been very energetic in making sure that there's food coming into the community and distributed through the whole of the community.
Just to hone in then, is it the policy of the local health district to be providing that support just to households with a COVID case in Aboriginal communities, or is the policy to provide food packages for every household in Aboriginal communities, considering, of course, there's restrictions on movement for starters?
Well, I don't think we can provide food into every household in every community that's got an Aboriginal person in the community. We've done a lot to provide additional food into both Burke and Ngania. I know there's an extensive network of a food facility, the warehouse, the distribution of that throughout both Burke and Ngania. I'm sure Mr. Warboys has got further details and the support around this from police.
No, Mr. McLaughlin,
Okay.
I think you misheard the question. Ms. Fairman's question was about Aboriginal households that are in lockdown, not every community, but Aboriginal households in lockdown. So perhaps you misheard. Did you want to reflect again on your answer?
No. I was clear that we can't provide food into absolutely every household in a community with an Aboriginal person in that community.
No, the question was Aboriginal.
So in Angonia, for example, the policy is to, I think you suggested, that it's just those households which have COVID positive patients that are getting support at this point in time. Mr. McLaughlin, isn't it any wonder that we have distressed members of the community trying to get food packages to elders in places like Angonia, in places like Brewarrina, because they can't travel? We're hearing, of course, that they're being fined. Do you see the situation here that you will have Aboriginal households who won't be getting the groceries that they need during this outbreak?
Ms. Fairman, I don't believe there's a shortage of food coming into Ngania. Between the local health district, the food distribution network, Uniting Care and other organisations that are all providing food into the community. I understand there is an issue with people leaving community to go shopping, that there's been a lot of transport of food and other goods for people to save them leaving Ngania, to save having to go to Burke. Now, I don't know every household's details and all of their needs, but there's been a lot of efforts to make sure that it's well catered for.
There's a people tweeting literally 10 minutes ago that some households in Angonia have had no food delivery in 2 weeks, but lots of cops and the army bought in, and that their food delivery for the elders could go no further than Brewarrina. This has just come in now. Is this New South Wales Health's responsibility?
No.
Right. Deputy Commissioner?
Yeah, thanks, Kate. I certainly support Scott in that I think there's an abundance of an effort going in terms of food right across Western and Far Western New South Wales. If people are feeling left out, if people feel that they need food or other hygiene substances, that's a part of the emergency management response that we can wrap around health and have done. There's certainly, I haven't heard what you're reading on Twitter at the moment, but certainly we'll take a look at that. As I said, every other day we're sitting down talking to Mr. McLaughlin and his colleague in Far West, talking to the liaisons, and making sure that, as we often say, that no person is left behind in this emergency. So if that's the case, there wouldn't be a person sitting here that wouldn't want that rectified. And if you would forward me those details or allow me to have a discussion around that with Scott and others, I'm sure that those people, Resilience New South Wales and others that deliver food and other items that people can pick up, those that feeling they're missed out.
So is the ADF and the police, or is the police just delivering food to people who are COVID positive in households to households with COVID positive people in them. Is that the instructions that the police are getting, Deputy Commissioner?
Yeah, thank you. So my understanding is that in terms of a priority, it's certainly about close contacts and positive cases that can't move. There is no restriction on people to move in the normal course of the day to collect food items, no matter how far that is. But I would certainly having a good understanding if there's someone that provides for elders that is positive or a close contact and they can no longer do that for elders, there certainly is a need for us as an emergency management community to provide those people with some assurance that they can get food and other items on a needs basis. So I fully understand the premise and the concern that you have, Ms. Berman, and we'll take it away. We'll take it away and we'll discuss it this afternoon and tomorrow. And if you have any specific details, I'd encourage you to forward those to either myself or Ma'am Pearce or whoever, and we'll certainly attend to it. There's not a person sitting here that wants to see anyone suffer or be put out any more in these communities than what they are at the minute. It's a very challenging time. It's a very confronting time. And every single day, as Scott said, we all lose sleep over the fact that there's someone getting left behind or someone that's in a position where we could help them.
Thanks, Mr.
Mr. Shoebridge, can I also just, if you'll just give me one moment, I think I answered a question about the pandemic plan earlier and undertook to provide that on notice, which I will, but I think I did my public health colleagues an injustice. The two pages was certainly about, I think, the police response, which I alluded to. The other part of the plan is many more pages, but I'll certainly provide that on notice as I've indicated.
Well, Mr. Warboys, if you've got it to hand, if you could provide it to the Secretariat today, that would be very helpful.
I'll see if I can do that, but certainly I think by tomorrow for sure, Mr. Shoebridge.
Thank you, Mr. Warboys. Well, unfortunately, we have run out of time. Mr. Warboys, I might just ask you to take one other question on notice, if you wouldn't mind. Have New South Wales Police stopped food deliveries to any town, any Aboriginal community in Western and Far Western New South Wales since the latest outbreak in June? And if so, what are the details of those? Because my office has had multiple reports as well, Mr. Warboys. So if you could just take that on notice and give us a response, I'd appreciate that.
I certainly will. Thanks, Mr. Shoebridge.
Thank you. Look, can I thank all witnesses for their evidence today? And I think a number of questions have been taken on notice. The Secretariat will contact you and provide you with further details about any questions that have been taken on notice. And I just remind you the maximum period to provide those answers is 21 days. But of course, given the nature of the crisis, the sooner you can provide those details and they can be part of the committee's deliberations and publicly available, that's appreciated too. Again, thank you. And that concludes today's hearing of the Public Accountability Committee's COVID oversight.
Thank you.